We got your 6
at 6 a.m. with the link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Coming up, former Second Lady Jill Biden joins us to talk about getting voters motivated to vote for her husband. Plus, we'll look at the growing crisis facing students this fall as part of our special series, School Matters, coming up on CBS This Morning.
Half a day. I'm Dr. Jana Manglona, Medical Director for Public Health. We all play a role in slowing the spread of COVID-19. We must continue to stay strong and practice everyday preventive actions to keep our island safe. Maintain a distance of 6 feet between yourself and others. Wear cloth face coverings in public settings. Wash your hands for at least 20 seconds. If soap and water are not readily available, use alcohol-based hand sanitizer that contains at least 60% alcohol. Clean and disinfect frequently used surfaces. Avoid touching your face. Stay home if you're sick. Let's protect ourselves, our loved ones, and our communities. Prevention saves lives. For more information, please call 311 or check out our website at dphss.guam.gov.
Kau sinja uli di sombrancelten meg, et zu ite saluda antes hum niga. Radzaudzan malak estrezas durante todo memu a nogi distancia como kupugi palu zaniman malak guafi con una sughiairi preba tu la noci nai banderata gaigi pues atan fanni bandera kau esta pagua pumalapa giluk tanu man libri centamiti man ko badi.
Say
Right on. Good morning on you. What a beautiful morning. Every morning you draw breath is beautiful. That's a good way to look at it. Just anything from here on up is a blessing. Good morning, Sabrina.
Good morning.
Getting it kicked off here with, because we played Uncle Toad in the anthem. I wanted to get his boy on here. Chamauli is, of course, Trey Cunningham and friends with a great cover of Ben Lam Lam's Oh, Jotnia Feels Back Home. The remix. 6:17. It's the link on the Breeze 93.9. Good morning, Guam. It's Thursday, the 20th day of August. To our listeners on the radio, good morning on you. Thanks so much for joining us here on the Breeze. It's KUAM FM Agotnia Guam 93.9 FM. Hey. There's also audio streamed Docomo Channel 10. And good morning to our viewers on the TV, KUAM TV 11. Thanks for watching. The link will be with you until 8 o'clock this morning. And last but not least, on the Edward R. Murrow Award-winning social media networks of KUAM, good morning. Good morning, Roberto. Buongiorno, Guam, from the only Italian in Barragata. Well, good morning on you. Rosemary, good morning. Good morning, team. Dino, good morning, Guam, from Big Island, Hawaii. Ho, brada. Ho, brada. Molokai. Which one stayed a Big Island?
No, that's not
Udakain.
Hawaii.
No, because in Hawaii, everything stay big, brother. I don't know which one is the Big Island.
Wow.
Yeah, Pat Paulino, good morning to you, too. He says, good morning, KUAM team, listening and watching. Be safe, Guam. Chamarita Regis, big-time supporter. Thank you, Chamarita. Juanet Crisostomo, good morning. And Jenny, also good morning on you guys. And thanks for joining us here on our Facebook live feed.
Chamarita girl.
Jason Solis standing by. There was some discussion yesterday about getting him his own microphone.
We have to figure that out.
Yeah. Maybe we put you on the ceiling, dude. Like get you a Tommy Lee Motley Crue, like up on the ceiling with your own mic.
There you go.
He's Jason Solis. He got fans. You got an OnlyFans or just fans?
Only one fan.
It's in the works. Hey, Joe Sir, DJ Joe Sir, behind our stream this morning, and of course, Kengineer and the KUA Master Control team. Thank you guys for helping us get this show on the road. Good morning, Sabrina.
Half a day, everybody.
So, what are we looking at today? Some of the big news from last night.
Oh yeah, a lot of news last night. I was asleep when the JIC came out about the backlog in running tests of the samples that were conducted. So we've got that coming up, and we have news about Congressman Michaelson Nicholas and the Federal Election Commission. And then yesterday I had a long conversation with a woman who's with her 10-month-old baby at the Wyndham Garden. And, the moment she had gotten the clearance to leave, she was told within 5 minutes, nope, you got to stay. Your baby has to be tested. And so we're going to try and sort through all of that and a lot more. Yeah,
and then, while we're on the subject of quarantine, we're going to get on through the Zoom, unless they take him away before the time. Rob is in quarantine. He has, his story is just really mind-boggling and heartbreaking and just a lot of things. And so we're going to get you these quarantine nightmare stories. Somebody tweeted at me about the quarantine thing, and they were basically like, hey, Chris, people at Guam are getting locked up and no one's, covering it. The media's not covering it. I beg to differ. We have covered a lot of quarantine stories. I mean, going back to the first lockdown where we interviewed people who were in the Pac Star. We've interviewed people at Santa Fe, people at, Wyndham, at Days Inn. And so we really love to get these stories out to you guys because these people in quarantine are in such desperate and sometimes despicable conditions that the only choice they have is to reach out to the media.
Yeah. And, I think that for the most part, they all understand what needs to be done in terms of being in quarantine and ensuring, the island community is safe and protected from the coronavirus. But at the same time, just a simple decency, cleanliness. I don't think that's too much to expect if you're going to go into a quarantine facility. And I think early on we heard from people that were like, well, if I didn't have COVID coming in, I'm fearful that I might have COVID coming out of the quarantine facility.
Right, yeah. Yeah, and I mean, it's just, I get videos. I got a video from a gentleman who was in quarantine at the Bayview, and the bed, I mean, he just checked into the room. The bed, blood stains on the bed, hairs on the bed, stains on the carpet. And this guy, I mean, he didn't even want to like go. He's like, no, I just want to share it with you. I don't want to cause any. And that's the thing is these people, like you said, they understand why they're in quarantine. Nobody in there is like, just let me out of here. COVID is a hoax. No. They're like, I understand what I got to do. I got to be in here for 2 weeks. But Lana, at least, you know, not Gus Guam.
Mm-hmm. And the sad thing is that we have brought this issue up many times.
I'm tired of bringing it up.
And apparently nothing's really being done.
Mm-hmm. Yeah, okay. Well, at least we're going in with a positive mindset.
Hey.
It is what it is. 6:22. Let's go ahead and get the show started then. We'll start with a link update from the KUAM news team with our link update. Let's give it up for Jason Salas. Good morning.
Hey everybody, Jason Salas here, and here are your link headlines. Another jump in positive cases brings the island total to 599. According to the Joint Information Center and Situation Report, 22 new cases out of 524 test samples were reported. Of those new cases, 9 were from public health, 9 tested positive from diagnostic laboratory services, 2 tested positive from GMH, and 1 both at Guam Regional Medical City and American Medical Center. These cases are under investigation. To date, there have been 5 deaths on our island community with 363 people released from isolation. There are currently 231 active cases with 17 people currently hospitalized. Of the 599 cases, 525 are civilian and 74 being military service members. Community testing continues today for residents of Guma Tranquilidad in Tuman. On Saturday, community testing will be from 9 a.m. to 12 noon in Jotnya at the St. Francis Catholic School. Well, the clock is ticking for the legislature to pass the fiscal year GovGuam budget, as senators have not been able to meet in the Congress Hall because of a coronavirus-infected employee. They've instead been holding virtual meetings on the Committee on Appropriations. Discussions got bogged down Wednesday over a motion by Senator Jim Moylan to adjourn the committee meeting and go back to a face-to-face session Monday. Now, after lengthy debate, Moylan decided to withdraw that motion. Several senators pointed out a budget bill can only be passed on session floor, and further changes can also be made. By law, the legislature has until the end of August to pass a new budget. Well, the Guam and NMI delegations cast their virtual votes in the DNC. Making the announcement for Guam was Sarah Thomas Nedidog, the party chairperson. And for the recently revived Democratic Party in the Commonwealth of the Northern Marianas, it was chairperson Nola Hicks.
Guam. 70 years ago this summer, Chamorros became U.S. citizens. We are proud of our resilience, proud of our indigenous heritage, and proud to be part of this historic moment for our party and our nation. From the land where America's day begins, Guam cast 2 votes for Bernie Sanders and 11 votes for our next president, Joe Biden.
Northern Mariana Islands.
Half a day, T-Row, and hello from paradise, the Northern Mariana Islands. We may be far away, but we're American citizens. And this year, for the first time in decades, we finally have a Democratic slate. Because Democrats organize everywhere. But we don't get to vote for president, so please don't waste yours. The Northern Mariana Islands is proud to cast 2 votes for Senator Bernie Sanders and 9 votes for our next president, Joseph Biden. Sidus Ma'asi, Olamai, and thank you.
The Democrat National Convention continues through Friday, airing live from 11 to 2 on KUAM. Local fishermen be advised, effective today, federal law prohibits any activity within a 2.3 square mile area, extending the high tide line in the waters below the Finnegadson Small Arms firing range. It's been designated a danger zone. The announcement was made by the Department of Agriculture on behalf of the U.S. Army Corps of Engineers. The firing range complex is being built for the training of Marines relocated from Okinawa. Local activist groups such as Protei Letexan and Save Retidian have opposed the range complex, citing destruction of ancestral sites and environmental damage. That is the news for tonight. Now let's get back to more right here on The Link.
The Department of Public Health's lab is having a hard time keeping up with the massive amount of testing that's being conducted, according to the Joint Information Center late last night. As a result,
Those that underwent testing can expect delays in getting the results. Public Health Director Art St. Augustine says, quote, getting patients accurate and timely results remains a priority for the department. He adds patients can expect to receive their results within 7 days. The most vulnerable, including healthcare workers and those who are close contacts to a positive case, are prioritized. The JIC did not provide information as to how many test samples remain waiting to be ran through Public Health's lab. If you don't get your results within 7 days, you can call the Northern Regional Community Health Center at 635-7525 or 635-7526. Public Health, in the meantime, has postponed this Saturday's community testing that was scheduled for Jotnya. The agency is reaching its capacity for storage space for specimens and will need more time to be able to run the remaining tests as efficiently as possible. Public Health says that the specimen samples are properly stored and preserved. Public Health is planning to clarify its guidelines and requirements for quarantine and testing for minors and infants. According to Public Health's guidelines, it only recommends that children 5 years and older be tested for COVID-19 if necessary. The issue surfaced after a Guam resident returned to island last Thursday with her 10-month-old baby. Christina Leon Guerrero was waiting for her test results, which returned negative on Saturday. 5 minutes after being given the all clear on Saturday to leave the government quarantine facility to go home and quarantine with her baby on home quarantine, she was then told that her baby needed to be tested for COVID-19. Public Health spokesperson Janela Carrera acknowledges the guidelines need clarification, but states there is an alternative for Leon Guerrero to have her baby be tested at a private clinic of her choice. Carrera added that if she is able to provide verification of the appointment, she and her child can be released on home quarantine. Whether, in fact, however, infants need to be tested is unclear. Carrera stated at this time there really isn't a clear definition when it comes to age of testing. The public health spokesperson added this is an issue that is being discussed to clarify the age restrictions, the thresholds for the limitations on age for quarantine, and what age do we require COVID-19 negative results for the quarantine of minors. Christina, in the meantime, has scheduled an appointment for her baby to get tested, saying that if that's what needs to be done for her and her baby, she'll do it. But she urges Public Health Director Art St. Augustine to be more vigilant when these rules and memos cross his desk before they are publicized, to make certain, without a shadow of a doubt, that what they are asking of island residents is concise and consistent. We did interview Janela Carrera yesterday. Here's more from that interview.
Hey, I am calling because I just spoke with Christina Leon Guerrero, and I'm sure I believe you already know her situation.
Yeah.
Yeah. Okay. So, can you tell me what exactly are the guidelines when it comes to infants needing to be tested?
Okay. So the guidelines that were based off of that were provided to her, so the ones that she's referring to or using, it's based off of Rev 6 and Rev 5 and Rev 6. So at this time, there really isn't a clear definition when it comes to age of testing. I know that on the DPHS memo that's being used, I think it's on the first page, it says age 5 for children for testing when it comes to quarantine travelers. Now, there is also, I think it might be on page 5 of the guidelines, as far as there's an offer for an alternative, which is what we are prepared to offer to Ms. Christina, is that they can get tested at a private clinic of their choice for her baby. So that's what we are going to propose to Christina at this time for her baby. I think it's just a matter of making sure that we have everything set to go with our team. And it's unfortunate what happened with her situation. We're aware that it's the communication that happened between our team and with Ms. Christina and with the and we are working to resolve the issue as soon as possible.
So you're saying that you guys are going to offer to her that you will let her go, but she will need to go to a private clinic to have her baby tested?
Yes, and that is something that she has agreed to do. The only thing is the issue that we're running into is finding a private pediatrician or any pediatrician that she can find that is willing to conduct a COVID-19 test for her baby.
Is this the first time you guys have ran into this issue or have mandated that a baby be tested?
I'm not sure if this is the first time, but these aren't unusual issues. We have run into issues where there were children or minors who were close to the age of infancy where they tested positive. And so, we take extra precautions, even though, children seem to be, not showing symptoms or asymptomatic. We just want to take extra precautions to make sure that, when they're released, there's no potential exposure out in the community. And so I think, with our team at the QFAC, they're just doing everything they can before there's any type of release out, even if it's home quarantine. I think that's, where the extra precautionary measures were taking place. Right,
but those situations that you were referring to, were these minors that were close to infancy, were they exposed to somebody that had tested positive? Because Christina said that she has tested negative and her baby hasn't been showing any sort of signs or symptoms.
I'm not sure what the individual situations were with the previous cases where the minors or the children had tested positive. I'd have to check with on those previous cases. But I'm not sure this is the first ever where we've had a situation similar to Christina's, but it wouldn't be the first time where we've had an infant or a child in our facility where later on they did turn out to be positive.
Okay. Oh, so she's going to stay there until the government can find a clinic where her baby can be tested.
Yes, that's part of the guidance memo, the alternative choice, which is if she can find and schedule an appointment for a private physician who can schedule an appointment for her baby to be tested.
Do we not have any physicians currently on Guam that can test babies?
I think she had tried to schedule one. I'm not sure if that appointment was scheduled or if the private physician that she had found was not offering COVID-19 tests.
Again, public health plans to revise and clarify their guidelines when it comes to testing requirements for minors and infants. 2 more police officers tested positive for the coronavirus. This brings the total number of police officers in the past couple of days that have been infected with the virus to 4. The 2 positives reported earlier this week were assigned to specialized units. One from Wednesday was also assigned to a specialized unit, while the other was assigned to GPD's Administrative Services Bureau. Police spokesperson Paul Tapau couldn't say how many officers may have had contact with the positive cases, but assures the community that GPD is making the moves necessary to cover down. All 4 officers are on home isolation. And joining us now with regional headlines, we bring in from our Zoom room, Tomas Manglonia. Good morning, Tomas.
Good morning, Bree and Chris. Here's the latest making news in the CNMI. The CNMI Labor Secretary Vicky Benavente announced that the island's participation in President Trump's unemployment assistance program under his executive orders. The new order means that the local government would carry about 25%, $100 of the $400 in aid per person per week. She says the administration will be meeting on Friday to finalize the application to FEMA. She noted that there's a lot more work to be done on its implementation. Meanwhile, she spoke to media early yesterday outlining the timeline ahead. Take a listen.
We spoke to the Federal Emergency Management Assistance people yesterday morning, FEMA, with regards to President Trump's executive order for the additional lost wages assistance program. The CNMI is going to apply for that program because it will help more people with unemployment assistance if they qualify. Because we know that KUA will end in December and the FPUC has ended July 31st for those who have not applied yet. So to let you know, we will be meeting as an administration on Friday to finalize an application to FEMA for this additional lost wages assistance program. This is a new program, an additional unemployment assistance program. I'll definitely lose all my black hair for sure if I have any left. But it is going to be coordinated with the Department of Labor and Team SHRM, Team HandMe, Team Business Community needs to come together to help us implement this program without all the kinks in the system that we had 60 days ago. I can tell you that within 60 days since we launched KUA, many things have changed.
And in other news here, the latest numbers from the Commonwealth Corporation, as the CNMI has tested nearly a quarter of its population. The CNMI remains with just 54 cases. 28 of those cases are from travel, 10 are from community cleaning, and 16 are from known contacts. The CNMI governor is expected to hold a press conference updating the community on COVID-19 at the end of this morning. Hearing Chris, that's making news containing COVID in the
All right, thanks a lot, Tomas. The Federal Election Commission has put Congressman Michaelson Nicholas on notice in a letter dated August 18th to the Congressman's campaign treasurer. It states that it has come to their attention that they may have failed to file their pre-primary report for July and August. The campaign has been given 4 business days to file the report. The letter from the Federal Election Commission states failure to timely file this report may result in civil penalties, an audit, or other legal enforcement action. According to the FEC website, Democrat Robert Underwood and Republican Will Castro have filed their reports. It's day 3 of the Democratic National Convention. Skylar Henry is in Washington, D.C. with some of the highlights from last night and a look at what we can expect to hear today.
Our friend, Delaware, Joe Biden.
Night 2 featured a unique roll call spanning the country as Democrats officially nominated Joe Biden to be their presidential candidate.
From the bottom of my heart, thank you all.
Joe Biden made a personal case for the nation to elect her husband, pointing to the way he handled the tragedies of losing his first wife and 2 children.
I know that if we entrust this nation to Joe, he will do for your family what he did for ours. Bring us together and make us whole.
This morning, Jill Biden appeared on CBS This Morning and discussed why Biden picked Senator Kamala Harris as his running mate.
Joe really admires strong women, and I think Kamala is a strong woman. She's fierce, she's tough, and that's what we need going forward.
Sources tell CBS News Kamala Harris will set out a vision for a more inclusive nation in her speech tonight, highlighting her own story as the first black woman and person of Asian descent to be on a major party's presidential ticket. It's likely we'll also see Senator Harris continue in the role of attacking President Trump and his response to the coronavirus pandemic.
His delusional belief that he knows better than the experts. All of that is reason. And the reason that an American dies of COVID-19 every 80 seconds.
Former President Barack Obama will also speak tonight, praising the man he picked to be his own running mate in 2008. Skylar Henry, CBS News, Washington.
All right, and you can watch NBC and CBS's coverage of the Democratic National Convention this week. It starts at 12 noon. Again, that's on KUAM TV 8 and KUAM TV 11. And we want to go ahead and bring in, are we bringing in Tomas? No, we're not? Okay.
He's coming back because he's covering the CNMI
right.
Press conference. All right, okay.
Good morning. It's 6:40. Thank you, Bree.
Yeah, you're welcome.
Okay, we're going to take a short break. And let me just run down the lineup for you guys this morning. We're going to get the United States District Court. We have the Chief Judge Francis Tydenko Gatewood and the Chief Deputy Chuck White coming on to talk about their PCOR 1 posture. And we'll also catch up with Dr. Mike. I did an interview with him. I want to say it was a couple weeks ago. Right. Remember, he caught the COVID, and we were able to do a cool little Zoom. So we want to catch up with him. And then I know Bree wanted to ask him about...
the testing of babies. And
testing the
infants.
babies, right. Yeah. So, and then we'll get Ray Tapasio, the Gura director. He had an interesting idea to build a quarantine facility at the airport. How's that? And we'll talk to him about that. Then we'll also get, like I told you guys, we're going to do a little bit of quarantine nightmare. We'll go into quarantine this morning. Fortunately, we're just going in by way of Zoom because once you go out, what we hear, or once you go in, it's very hard to get out. And then we got Attorney Tom Fisher. There was a pretty interesting ruling that came out in this FOIA lawsuit between Attorney Fisher and the Attorney General's office. And basically, that ruling coming down from Judge Iriarty that your elected leaders and their political hires WhatsApp messages, pretty much WhatsApp messages are now FOIA-able. So I think that's huge. I've tried to FOIA WhatsApp messages before. I never got them. So that definitely is a game changer. And we'll talk with Attorney Fisher and kind of look at what that means moving forward. And then we have Rear Admiral John Manoni coming on. The Admiral is going to be talking about
what's going on with Joint Region Marianas. We just want to check in with them and see how things are going.
Right. And then 9:30. This is key. There was a big meeting. Public health meeting last night, and I'm guessing it was, centering on this backlog of tests that they have yet to run. We couldn't get a number. I asked Janela Carrera yesterday. I said, how many tests are you guys backed up? She said, I'll get that number for you. I know they're busy. And so we're going to get Dr. Suzanne Conachero and Annette Uggan from Public Health on around 9:30, and we'll kind of go in and figure out what this means. I think it's a problem, though, Bree, when you go in and get swabbed over last weekend, and these people who got tested over the last weekend, which was already Thursday, Wednesday, Tuesday, Monday, it's 4 or 5 days ago, they're now being told they're going to have to wait another 4 or 5 days. I was talking to someone messaged me on my Instagram, and they're like, yeah, we just got a call that it's going to be another 5 to 7 days. So the problem is if you go and get swabbed over the weekend, like last weekend, when you finally get your results, they're dated. Because on that day, you may have been COVID negative, but who knows what you did between the day you were swabbed and the day you got your results, who you interacted with, what type of exposure you may have had. And hey, don't take my word for it. This is what doctors are saying. So we'll definitely ask public health
I
about
know
this.
that we have a photographer that has been waiting for his results, after what happened here at KUAM. And we're still waiting till this day.
And it's unfortunate because, we need that negative test for people to come back to work. And now we're just stuck waiting on public health. And this is life and death. It's a pandemic. This testing is supposed to be one of the key components. But if you really think about it, if they're not running the results from the tests they've taken, are we really getting the full picture of how bad the spread of this virus is on the island? Mm-hmm. No, we're not. We're not, because if they ran 1,400 tests over the weekend and they still have how many more left, and we're getting these results where it's 42 cases, 22 cases. That's not even the whole picture.
Yeah. And just a reminder that they made the announcement last night that the community testing that was scheduled for this Saturday in Jonya has been postponed until further notice.
Well, of course it has, because if they can't even run the test from the last community testing, why would they have another one this weekend?
Right. Well, I don't even know why we're just finding out about this, and they're not being as transparent. Like, let us know how many, where are the samples being stored.
How hard is it to just go and be like, hey, how many tests we still got in the fridge? Because these tests, basically, your nasal swab is sitting in a refrigerator somewhere. It's sitting in a refrigerator somewhere because public health doesn't have the manpower. Is one of the reasons they gave, was that, hey, we need all these lab techs. They're trying to get another machine. And so we're just, I guess, overwhelmed, right? And it's dangerous. I think it's really dangerous. 6:46, we'll take a short break and come back with more of The Link on the Breeze 93.7 9, which is proudly brought to you by First Hawaiian Bank. Their drive-through opens at 8 a.m. The inside the bank opens at 9. They go till 4. And you can check out their social media or fhb.com for more information. Good morning.
Nobody likes
Whether
that
it is
guy.
tablets for children, special equipment for special children, or coral reef research, federal support is critical for our schools and our future. This week, we're trying to open schools. Parents are worried about their children's safety. Teachers are being asked to work minor miracles every day in teaching without looking directly into the eyes of our children. We must make sure that every child has a tablet, can get online, and get on with their education. We need a congressman who understands education and how the federal government can support every activity in the classroom, in the laboratory, and in the internet. Now more than ever, we need a congressman who will assist GDOE, UOG, and GCC without hesitation in solving problems with federal agencies. It's time that your child takes center stage, not only in school, but in Washington, D.C. I'm Robert Underwood, and I approve this message.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
You live life on the go, and now so does your mortgage application with FHB Digital. It's easy and fast, with features that gather your documents or make it simple to upload them yourself. FHB Digital provides personalized mortgage options to suit your budget. And if you have questions, just ask a loan officer. FHB Digital. Bank at the speed of your life with First Hawaiian Bank.
Cry no more. No man can never love you the way I love you. You was all I want. You was all I want, girl. I can never leave you. Can never hurt you. I can make you cry no more. No man can never love you the way I love you. You was all I want. You was all I want, girl. So tell me what's on your mind. We can spend some time sipping fine champagne and catch a little buzz while you freak okay. I know it sounds crazy, but I'm feeling kinda ill for you. I've got this thing for you, cause everything you do, you got me into you. You got me into you. And I don't ever wanna let you go. Never, never, never let you go. So I want you to know I will never leave you, will never hurt you. I can make you cry no more. No man can never love you the way I love you. You was all I want, you was all I want, girl. I can never leave you, can never hurt you. I can make you cry no more. No man can never love you the way I love you. You was all I want, you was all I want. You're like an angel in disguise, my eyes could not see. From staring at your body, you're
Savage K all day, baby. Good morning, it's 6:50. It's the Link on the Breeze, 93.9, Thursday, the 20th day of August, as we inch towards the first week of a PCOR 1 lockdown that, I don't know, Sabrina, to me, when I go out there,
No,
I feel
it
like it's
doesn't
like
even.
PCOR 8.
You know, Jason and I were talking about this because he called me yesterday after he got done doing the news about what we saw when we went home. Tuesday or Thursday? Tuesday night.
Right.
And
this was during the lockdown, this
yes,
PCOR 1? Okay.
Tuesday.
Hmm.
So on our way home, he saw it and I saw it. The parking lot over at the old Dededo flea market, they had like the food trucks out there. People were getting food. And it was, to me, it kind of pissed me off. I was like, I thought we were in PCOR 1. Why are we having all these food trucks out here?
Yeah, because they can do the curbside. That counts as curbside pickup.
Wow.
Right,
well,
yeah.
that was still a lot of people.
I know.
And I didn't see the 6 feet away or anything.
Yeah. So, and again, guys.
I was going to get down and get video, but then I was like, oh, no. I need to get home.
Should have got down and got short ribs. Yeah. Yeah, but guy, I mean, it's just, what do they tell us? You know, we gotta kill this curve, and we just got to do our part, and it's frustrating because I know you guys look out there and you see what the government's not coming through with running the tests, and it's frustrating that we're being expected to do our part and we're not seeing the same thing from the government. We got to get these numbers down, and we don't even know if we're getting these numbers down because we're still trying to run tests from 4 days ago. I'm gonna get my magic wand. Did we still got my magic wand?
I think it's somewhere in my in the office.
Yeah. I mean, that's a containing COVID thing. Hey, shout out to everybody who knows what we're talking about. But I might have to bring back that wand because, 6:52. Good morning. Let's head over to the KUAM News Zoom room where we're going to switch gears a little bit and bring on the district court where we have the chief judge, Francis Tedinko Gatewood, and the chief deputy, Chuck White, in our KUAM News Link Zoom room. Good morning.
Good morning.
Good morning.
Off a day.
Hi.
Morning, chief.
Morning.
How you guys doing?
Good.
We're hanging in there.
Hanging in there, right on.
As all of us are, right?
Chief, I know you're doing good, but are you doing good?
Well, I'm trying to. I'm doing okay. Let's just put it that way.
I feel you. Yeah, it's definitely a crazy time that we're living in. We're all trying to make sense of it. Hey, we got you on because I know that you guys have kind of changed some things with the PCOR 1 declaration, but I know that the changes you have made didn't just happen overnight. There's all kinds of planning. So can we just start there? What is you guys' PCOR 1 posture? Tell us a little bit about the operations for the federal court.
Well, I'll talk about it briefly. Then I'll have Mr. White, my chief deputy, talk about it a little more in depth because actually, Mr. White, as the chief deputy of the United States Federal District Court, he handles the operations, and he's been very much front and center in getting our court ready and leading our court personnel, including me and Judge Berdalio, in preparing for the different condition of readiness for our court, consistent with the governor's pandemic condition of readiness. So, of course, the courts have to balance the rights of the defendant, the right to a speedy trial, the right to due process, the right to have in-court appearances for guilty pleas, sentencings, trials, and so forth. We have to balance that right with the right of the public to be in a healthy environment, the right of our staff to be in a healthy environment, and to be in a safe place. And if we don't get, like, for example, Mr. White and I can talk about that a little later, but it's just taken a lot of effort. It's taken a lot of time on his part as leading the court and with Jeannie Kanata, our clerk of court as well, in putting our plans together and how are we going to handle having people come into the courthouse. And it's not just for our court, it's not just for the court hearings. We also have tenants in our courthouse. We have the Secret Service, the Department of Labor, the Guam GSA, our United States Marshals, U.S. Probation and Pretrial. So there's a lot of tenants as well that comes into the courthouse. And so we've just, there's just been so many things we've done. And maybe I can have Mr. White just talk to you. Is that kind of, you want to just him to give you a brief background of what we've done, and then you could ask questions. That might be a lot easier.
Sure, yeah.
Mr. Chris, okay. I call you Mr. Chris
I know.
Malfunction.
Mr. Chris Malfunction. Okay. It doesn't really match, but okay.
Yeah, it certainly doesn't.
Okay.
Thanks. Okay, Chuck, take it away. You got to say at least 500 words when you come on the Zoom, so go for it.
Yeah, certainly the pandemic has posed lots of business problems for us, and some of the business problems are the same problems that every other business faces. Anyone with a public-facing service counter. So we've done all the standard things that your listeners have heard about: social distancing, screening at the door, hand sanitizer everywhere, that kind of thing. But the real challenging business problem, I think, is jury trials. That fundamental constitutional thing. And specifically jury selection, where we bring in up to 100 or maybe more jurors mid-trial. So that's a huge problem. And some of your listeners have probably heard about the CARES Act. That's that $2 trillion expenditure a few months ago. Well, the court didn't get any of that money. So what we're doing is using our existing funds to try to solve this huge business problem. But what the CARES Act did for us is that it allowed us to expand our use of audio and video technology. We still can't broadcast hearings, much to your chagrin. I know I'm always dealing with people that's asking if they could come in with their cameras. But we have a greatly expanded use of video and audio now. All of our hearings are available, accessible through a toll-free number for audio. We're using Zoom with our existing video equipment and other Zoom-like tools. But as the chief said, the rights of the defendants have to be balanced too. So the CARES Act requires that any hearing that's conducted by video, or at least if the defendant has to consent to appearing by video, they have the right to appear in person. So, and of course, the conditions have to be evaluated every 90 days and things like that. So that's what the CARES Act has done for us, and we've tried to leverage every single thing we have. We have 2 solutions for jury selection currently, and I think it's important to have more than one solution. The Chief Judge has arranged the possibility of off-site jury selections at the National Guard Readiness Center. And we have a solution for smaller trials, smaller jury selections in-house, using multiple rooms and using our video equipment.
Right.
So
How was the National
basically
Guard
where we're at.
Readiness
Our posture now, of
Center
course, is
selected?
I'm sorry, what was that, Sabrina?
I was just curious how the National Guard Center was selected for these off jobs.
So what happened was I spoke to Mr. White, and we have a very extensive plan, as he said, for the district court. How are we going to do jury selection at the district court? The problem is with this, even though I have a big court and a big courtroom, the social distancing, of course, just shrinks the number of people that can come in for jury selection, as Mr. White has said. So he and I discussed the issue of, okay, should we go out for a hotel ballroom? And so Mr. White, he can talk to you about that, the process of that. But when we discovered that might be a little high for us in terms of finances, I sat down and I said, you know what? What about the Readiness Center? I think I've been there, and it's pretty big. That's a big shell. Are we allowed to do it? So I just called up the Adjutant General, Ms. Esther Agagi, and I said, hey, is it possible that we could we rent it? What can we do? Is it possible that we can have jury selection there if you would allow us? And so she was very accommodating.
Wow. So it's like, hey, girl, can we do our jury selection over there, girl? Oh, yeah, we got it. All right, on, okay.
Well, no, she was accommodating for us to at least come down and then discuss it with her.
Right.
And she assigned Captain Manglotnia to work closely with Chief Deputy White and everything. And so, so that's how we got it.
Right.
I just remembered it. And so Mr. White, not only has Mr. White ensured that we have a plan for social distancing. We have like a map of the district court, if we're going to do jury selection there, of a specific hotel, if we were going to do it there. And now we have one at the National Guard Readiness Center.
Do you guys anticipate a lot of people, calling out or trying to call out sick from jury duty?
Well, you know what? So I'm going to have Charles talk about the polling, but just in terms of the results, but what I did was I've had 3 trials scheduled. I was supposed to start a jury trial last week, and we were all set to do it at the Readiness Center for jury selection only. The trial actually will be held at the district court. So we did a polling. I worked closely with Mr. White, and he and the jury administrator sent out the polls and to see what the comfort level is of the jurors. So Charles, maybe you could just talk about that briefly, like how many polls that we've had, and then just the results recently.
Well, what we've done, the Chief Judge has come up with a pre-screening questionnaire that we send out with jury summons. And that really is 2 purposes. One is to, as the Chief mentioned, is to gauge the comfort level of the jurors. Although I don't know if juries are ever comfortable, right? It's like going to the dentist. But
don't say dentist.
Oh, that's right.
Not really a good marketing pitch. Jury duty. Calling the dentist.
But the other purpose of it is to give jurors the opportunity to ask for a COVID-related excuse. Now, the COVID-related has to be, they have to assert that there's a few different circumstances, and it has to impact their ability to be a fair and impartial juror. And of course, that's subject to the approval of the chief judge.
Right.
But should help us pre-screen jurors so that on the day of jury selection, we're not dealing with an overwhelming number of people that want COVID-related excuses. That should be minimal. Right now, our comfort level, I think, is about 50-50. People say some degree of discomfort, some degree of comfort. It's about half and half. Far fewer, though, have actually asked for excuses.
So how does
Probably single-digit percentages. Yeah.
So how does this work for the people that are willing to come in and to go through the jury process? Do they get screened, or before they come onto the base? How does that work?
Oh yeah. So this is how we're working it out with the National Guard. They're going to, as I understand, they'll get a list of the names. They'll know exactly who the names of the people are coming in. So that's how they're going to go through that gate there, and then they will be directed to a certain place, and then they will be screened by Mr. White and the staff, the jury administrator, and the other clerks. That's how they're going to get in.
Okay. When you say screening,
No.
like a medical screening or temperature checks,
No.
things like that, or
The court has a series of 4 or 5 questions we ask, and this is questions about exposure to COVID-19,
Right.
The quarantine status. I believe also that the National Guard Readiness Center has a temperature temperature taking protocol. At the current time, the court does not, and at the courthouse, but I think the National Guard Readiness Center does. Everyone that goes in there has their temperature taken.
Wow.
Most jurors, my opinion is that if a juror knows that they have a temperature, they're definitely going to use that as a reason not to come.
Right.
And a good reason.
And there's
So
also
I think that should be minimal.
the whole asymptomatic, temperature checks are fine and good, but there's a whole bunch of people who have COVID and are asymptomatic and don't show any symptoms. So, hey Chuck,
Right.
I was curious, so let's say we get a trial, we have a jury, someone in the jury catches COVID, right? I mean, what kind of plan do you guys have to do, like contact tracing, and then, obviously you're going to have to replace those jurors? Would you just use kind of pre-COVID protocols? Let's say pre-COVID, someone, whatever, something happens and they can't do jury duty anymore, you just replace them. So, yeah, what are those protocols? If someone catches COVID, how do you deal with it?
You mean like during?
Yeah,
you mean
during
like
the-
if we have already selected a jury, for
Right.
example, and then all of a sudden during the trial, the jurors a juror has contracted COVID.
Right. Right.
Well, so we would follow the protocol that's required by the epidemiologists and the government. I mean, Chris and Sabrina, the court has been advised. Our court has been advised to follow the, look at what the governor and the Department of Public Health and Social Services are doing in terms of the protocol, whether it's, pursuant to the Centers for Disease Control, the World Health Organization. So I suspect that I know for sure that's what we would do. We would have to call off the trial. I mean, everybody would have to get tested,
Wow.
especially if the jurors were in contact with a fellow juror, and if the staff was. I mean, we would follow that protocol. Mr. White, you want to chime in on that part?
Yeah, there'd obviously be what we call continuance, which in ordinary language would be a postponement for testing. Every jury panel has a series of alternates too.
Right.
Typically with the chief judge's trials, at least 4 alternates. And it depends on how long the trial. A great number of our trials should only last less than a week, even if jury selection is a little bit extended. The social distancing inside the courthouse or offsite is strictly enforced. So it's not like, for example, jury deliberation is going to happen. And those jurors will be deliberating in a socially distant manner. in the same room, in a very large room. So it won't be huddled together, for example.
Yeah.
So trying to minimize that, but that's an excellent question.
Yeah.
But it would be than normal protocols, and probably using at least one or two of the alternates.
Yeah, and that's a good point. So Chris, if say we do go 14 days, well, I'm hoping that we could get fast test results. I mean, the results for Guam sometimes are as early as 1 day. I don't know about hours or minutes. You hear that on TV.
They have a rapid
I
test, Your Honor. The Abbott test, I believe, and it's 15 minutes. But then those machines can only run a certain number of tests per hour.
Yeah.
And those tests,
so,
I mean, for example, public health will use those tests on people who may have come into close contact with a confirmed positive.
Right. And so the issue too is, like, even if they came into close, if they came into close contact, even if they test negative, they'll probably go into quarantine. As Mr. White said, if it's a 14-day quarantine, we'd have a 14-day continuance. But say that particular juror that tested positive is just not doing well. Well, then I would just excuse that juror and I'll pull up an alternate.
I see. I guess, Chuck, is there anything else you want to add? I did have kind of like one last question that maybe you guys can close with, if you don't have anything else.
The one thing I would say, I would ask, and I don't know if Mr. White wants to say it. I'm glad you asked us to be on here, Chris and Sabrina, or allowed us to be on your show. Is that we do have the polls going out to the jurors, the jury pool, and it's really important for the court, for me, for the lawyers, to know how comfortable people will come in, how comfortable people will feel about coming in to sit as jurors. Obviously, if they're not comfortable, then you know what? The defendant's not going to have a trial. They're not going to have it today. They're not going to have it. Well, it might be a while.
Yeah.
They're not going to have their jury trial. So I would just encourage that those persons who have the questionnaire that we've sent out, it's a 12 questions, and we've already sent it out by snail mail and by email, and we want that returned so that we can get the results.
Right.
Thank you. And Chuck, I don't know if you want to add anything.
Yeah, just that we're right in the middle of this thing, so we're not even pretending that all the answers and business problems are solved, but we're just striving to make not only the jurors actually safe, but for them to perceive and to really believe that they're safe, so that they can make that impartial decision.
And I guess my last question is, we've got some really big trials, not just going on, but about to be going on. And I just want to see your statement. Are we, with all of this going on, are we still able to confidently say that we're pursuing all of these cases, to the best of our ability? Because this COVID is a huge curveball. And I see, on the local government side, things that are falling through the cracks. And, I just don't want to see that with the district court, especially I feel like there's, like I said, some big cases before you guys.
Mm-hmm. Well, let me just say, I can assure the public and the defendants and all the attorneys at the federal court, and I'm pretty sure it's the same with the local court as well. Having come from there, everybody has a strong interest in ensuring that the defendant's constitutional right to a speedy trial, a fair trial, is held. And so we are doing everything in our power. Believe me, I mean, we're doing everything in our power to try to get the jury trials, to get them going. The problem is, I mean, if this COVID-19 pandemic continues to scare the public, then the likelihood of us getting them in the courtroom is very low.
Wow.
And so, but we just have to be patient. And, even though some defendants will say, well, Judge, you know what? I don't care. I'm continuing to assert my right to a speedy trial. You know what? We all the judges, all the lawyers, all the clerks, we all respect that. The thing is, if you can't get jurors in, you just can't get it in. I mean, it's just an impossibility.
Wow.
So we just have to wait. But I can promise you that we're doing our best to get everything in order. We are ready. We are honestly ready to go. It's just the question is the public ready to be here?
Right.
But just to follow up on that, what happens though, Judge, if you get sick, or if or if like Judge Vidalio gets sick, and we don't have a judge? What
no,
do we...
if I get okay, Okay, let's say a lawyer, say a defense lawyer gets sick,
Mhm.
right? There's in the Speedy Trial Act, there's an exception to continuity of counsel. So they're going to try to get that lawyer fixed. Better.
Give him an oil change.
No, but let me tell you, there are some lawyers that have come into our court, and Charles and I have talked about. There's some lawyers that said, "Look, I have comorbidity issues. I have diabetes. I have a heart disease. I have this and that. Judge, I'm scared to be around anybody because of my own health." And we understand that. So we are working with those defendants to have distancing meetings. But so if I got sick, we would continue the trial.
Okay.
We're not going to get another judge unless I'm deathly sick or something.
Right.
But yeah, we would continue and then come on in just like anybody else.
Right on.
All right.
Well, thanks for coming on, and keep us posted. I don't know if you said, but how many jury questionnaires did you guys send out? Because I might have missed that. Chuck.
Well, Chuck.
Jury poll.
I think about 250 to the randomly selected ones that are for upcoming trials. And I think in one batch we sent out twice. We sent the same questionnaire a few weeks apart to gauge whether there's a difference.
Okay, all right.
And we're still getting.
And so what you should know though, Chris, is that, and Sabrina, is that when we sent out the first poll a couple of months ago, the comfort level was very low because this was the COVID was just really starting to generate. Then we got our results back on the next polling that Mr. White and our jury administrators sent out, and 75% of the those polled, our jury poll, they felt comfortable. They said, okay, we feel comfortable if the district court really has sanitizers, masks. We're going to make all that available, even shields. I think we're going to try to get shields, face shields, and everything. If you're keeping your court clean, FTG and Chuck and everybody, then we'll come in. They're fine with that. And then now that we're back, so we're now back in pandemic condition ready 1, right? So now I asked Mr. White to please send out a polling, and so we're getting the results now. I bet you those results will come back not as comfortable.
Right, correct, yeah. Well, thanks, Chuck. Your Honor, thank you for coming on. It's good talking with you this morning.
It's my pleasure.
Thanks. Stay safe.
Right, bye-bye.
Stay safe.
Okay.
Bye-bye.
All rise.
All right, take care. Thank you, Charles.
Okay, thank you.
He's been wanting to say that.
I have.
I've been waiting all morning to bring that one out.
Thank you, Chuck. Okay.
Right.
Okay.
We need to get a gavel too.
I got a wand.
I think I have my son's Thor gavel. I'm like,
the Mjolnir. Hey, it's 7:14. Dr. Michael is right there. We're going to take a short break and come back with Dr. of One Love Pediatrics. Good morning, Guam. It's The Link on the Breeze, 93.9.
I was superintendent of education for many years, and he was president of the University of Guam for a decade.
Together, we worked hard to extend opportunities from the youngest of our children to senior researchers at the University of Guam.
We understood that public service and the economy begins with education and returns to it time and time again.
But we're also partners in life, bringing together 8 children of diverse backgrounds, 14 grandchildren, and 1 great-grandchild.
I was born in Iloilo in the Philippines, and he was born in Tamuning, bringing together another combination of experiences which enrich our lives and our island home.
When we say, Si Jules Maasi,
and Maraming Salamat po,
it is because we have been saying it all of our lives, not just during a campaign. I'm Robert Underwood, and I approve this message.
You live life on the go, and now so does your mortgage application with FHB Digital. It's easy and fast with features that gather your documents or make it simple to upload them yourself. FHB Digital provides personalized mortgage options to suit your budget. And if you have questions, just ask a loan officer. FHB Digital. Bank at the speed of your life with First Hawaiian Bank.
Come Coming up, former Second Lady Jill Biden joins us to talk about getting voters motivated to vote for her husband. Plus, we'll look at the growing crisis facing students this fall as part of our special series, School Matters, coming up on CBS This Morning.
If you plan on leaving your house, don't forget your face mask. Along with hand washing and social distancing, wearing face masks can drastically reduce your risk of infection. Many people who catch COVID-19 can be contagious before they even start showing symptoms. The more people who use face masks, the less the virus can be transmitted and fewer individuals are exposed. When we both wear face masks, I protect you, you protect me, and we are both safe.
Why did you go? Did you find someone else's glow? Yeah. So in love with you. When's the album coming out? Should do that. Chris and Bree sing over your favorite local songs. It's like we're just putting a little MSG on it.
Just a little.
Just a little bit. We want you to get hives. 718, First Hawaiian Bank. Go pay your bills. The drive-thru opens at 8. I know. Okay, it's they go till 4, and they got the in-bank banking at 9. It's First Hawaiian Bank. Go to FHB.com. Also, IT&E and Cabo Enterprises. This is the link on the breeze. Here's what's coming up.
But if you can pay online, do that. Do it.
Yeah, definitely, guys. You know.
We want you to stay home.
You know. That's my grandpa. Once you heard that, that's like, oh, get ready. Here it goes. 719 coming up on the show. We have Rear Admiral John Manoni, 9. There's a bunch of questions for him. Attorney Tom Fisher on this FOIA lawsuit. Gura Director Ray Tapasnia. And then we'll talk with Rob, who's in quarantine. 9:30, guys. It's going to be. I think this is going to be our money call. Public health. We have Annette Uggan and Dr. Suzanne Kaneshiro to talk about this testing. They canceled, postponed is the word, but they postponed this weekend's community mass testing. And we did a story on the backlog of tests. How many tests? We don't know. We haven't been told, but hopefully they'll have that answer for us this morning. As people have been messaging me on Instagram and just expressing anxiety that they got, we had record turnout, Bree,
right,
for the community mass testing because people want to get tested for COVID-19. Now they're just,
And people they don't know if they've had close contact. They may have gone to this restaurant or that restaurant or this grocery store or so many places.
If you go and get tested, I mean, it usually comes down about the 1 or 2 days, right? That's been the way it's gone. But now, when I spoke to Janella yesterday, they're going to tell people another 5 to 7 days, which by the time you get those results, are they even any good anymore? Because who knows what you did, where you went, who you kissed, whose face you licked. It's just crazy. 720. Hey, so let's go to the KUAM News Zoom room, and we'll bring on Dr. Michael of One Love Pediatrics. Good morning, Doc.
Good morning.
Hey, morning, guys.
Wow,
Thanks for having me.
You're feeling much better, huh?
I'm feeling so much better. Yeah, thanks to everyone with their well wishes.
Right on. That's cool. That's cool. As you guys may or may not know, we had Dr. Michael I did a cool Zoom with him. He contracted COVID-19 from a small gathering with friends, right? And I remember, Doc, when we did the interview, pretty passionate when you talked about how you had came across this exposure, and you kind of fell on your sword a little bit, right?
Yeah, definitely. I mean, the definition, the CDC's definition of a close contact is 10 to 15 minutes, being within about 6 feet without a mask on. And yeah, it was a small gathering, probably 8 or 9 people. I was probably 4 or 5 feet away from the person. That person had no symptoms. Everybody thought we were all okay. And yeah, at the end of the night, I must have contracted it from him.
Right.
But
Can you just take us from when we last spoke? I remember you're outside in the backyard, sunbathing. Walk us through that conversation that we had to today. What was the rest of your bout with COVID like?
So I think when I spoke to you, that was right about when my sense of taste fell out.
Right.
And for the next couple of days, it was just some minor aches and pains. It felt more annoying than anything because at that point, the scariest part of COVID, I think anybody that's recovered from it already and is not knowing within this first 72 hours, your mind is racing thinking, am I going to be that unlucky person that ends up in the hospital? But by the time I spoke with you guys, I felt like the worst had already passed. Yeah, I felt a few waves of kind of low grade temperatures and chills and mild aches. But at that point, I was pretty confident I was going to get better. And since then, just a lot of rest. I've tested, we've had people come to my clinic and test, and some people have shown up and said, oh, I've had like this, it felt like a mild cold, but it didn't feel like anything out of the ordinary or out of the new that I've never experienced before. And I had to tell them like, hey, I just got back, from COVID, and I'm telling you, it doesn't feel like anything novel. The actual illness just feels like a relatively mild illness if you have, mild or moderate symptoms.
Right.
So you're back to work?
That's right. So went back to work. Tuesday was the first day I was cleared by public health for quarantine after Monday. And just kind of ease myself into it. I just today I'll have a couple patients, but really the bulk of it is a lot of people are looking for testing. And I heard on the break you guys are going to be talking to Dr. Kaneshiro later, but yeah, you're absolutely right. Public health is so backed up with testing. What we're trying to do is offer people DLS as an option, but it's not a free test at DLS. So there's their own fee associated with that. But some people are actually taking up on that because they want the results sooner.
Your clinic, wasn't it open over the weekend to take appointments or
It
something
was,
like that?
yeah, it was. But that testing, they didn't really need me present, right?
Right,
It was
right.
just people coming through who just wanted to get tested.
Did you have a lot of people come through?
We had a lot for our small clinic. I think we tested maybe 18 or 20, which for us is a lot.
Right,
but compared to AMC and public health, that's a drop in the bucket. But yeah.
Doc, going back to so last time we talked, and you said it was pretty minor. How hard was it? Because we're all used to working sick, right? You get the flu, you get a cold. I might miss a day, I might miss 2 days. Maybe I rarely get sick. But, I've gone back to work with a runny nose so how is it knowing that your symptoms are kind of tailing off? Yeah, I feel like I could go to work, but man, I'm still highly contagious.
It's so funny. I had a very similar thought as I was finishing up my quarantine. And I realized this is the first time since probably elementary school that I've been allowed to just completely recover from an illness before I went back to school or went back to work. Because, just like everybody else in the country, right when you think you're good enough to go back, you just kind of go back and you kind of gut through the next couple of days. So my first day back, I felt really great and pretty energized coming back to work. But one thing is, the CDC has some research and they found that 10 days from symptoms, most people after 10 days will stop having infectious particles. And for people with more severe symptoms, 20 days. So it looks like they haven't been able to recover infectious particles from what I read after 20 days. So even though I stopped quarantine isolation, of course I'm wearing a mask at work and being safe. But at home, I'm still sleeping in a separate room from my wife. We're not completely isolated. I stopped wearing a mask, but again, I still haven't given her a hug since I got sick. We're gonna wait till the weekend, which will be about
a day. Little candlelight dinner, little catch up with the wifey, right? Yeah.
Yeah.
Don't call him this weekend, guys. No appointments this weekend.
Oh my gosh. I wanted to ask about, you said you're back to work. You got cleared by public health. Did you have to get tested in order to go back
Because we
No, there's actually CDC doesn't recommend a test-based strategy for going back to work, mostly because some people are still testing positive weeks after they recover, right? And what we're figuring out is that they're not infectious, but we're picking up probably like viral particles
Right.
that are being amplified by the PCR. So if I test it again, even though I'm completely over my COVID course and I test positive, then it puts us in kind of a, well, we know you're probably over it, but you have a positive test, so the CDC isn't recommending that anymore. But yeah, the big concern, as I was finishing up quarantine, I'm reading up articles about some heart inflammatory issues that some German studies have come out, and I think JAMA has come out too. And then some patients looks like, hopefully a very small minority, but some patients are what they call long haulers, and they have these COVID symptoms for months after they supposedly recover.
Wow.
They're still dealing with fatigue and headaches, and I really hoping I'm not in that category, but who knows?
But if you're a long hauler, are you still, I guess, what is it? That you could still,
Contagious?
you could pass it along to
It doesn't seem like you're contagious,
Mhm.
but it's really bringing into question like what are the long-term effects of this virus, and if it's giving, if it lays dormant, if it what happens, we just don't know, right? We just don't have enough data yet.
But hey, when you went back to work, I'm wondering, was there like a stigma with, hey, I just saw Dr. on the KUAM Zoom. He has COVID.
It didn't seem like it. The one thing, I guess I can kind of, an extra benefit is now I'm COVID immune, right? So I don't know too many other providers that are COVID immune.
You got to put that on your sign. I know Bree wanted to ask.
Yeah,
about
I wanted to ask because we have this situation with a mother and her 10-month-old baby up at quarantine. She had tested negative for COVID-19. She flew in last week Thursday, and she got the results Saturday while she was at the Wyndham Garden in quarantine.
Okay.
And she sent all the information to public health. Hey, it's negative, and they told her, okay, you're good to go to leave. But 5 minutes later, after telling her that, they said, oh no, your baby needs to be tested. And she said, well, in the public health guidelines, it doesn't say that infants need to be tested. There's I think it's on page 1, about 5 years old, if necessary, can be tested for COVID. And I'm just wondering, do you know, do babies need to be tested for COVID? If they're not exhibiting any signs or symptoms or anything like that?
That's actually something that's come up a few times. Typically, I guess the advice that I was giving, because they asked me the kids to be tested, and generally our thinking was no, like younger kids, initially I think the cutoff we put at 14, and then the cutoff we dropped down to 12, and now might be dropping down to 10. Now that we're thinking maybe older kids might be able to spread a little bit more, but in general, kids that young, they're not going to really pose a threat to spreading it very well. We know that's that's something that babies and smaller children don't do very well. But I think public health was giving the option for a lot of parents to get testing, and that was something that a lot of parents took up from what I was told. I don't know about a mandatory testing for children. I would definitely have you guys ask, maybe Dr. Kaneshiro knows a little bit more about that, or it might be something that they're just kind of doing internally.
Right. They said it was
really
an option to go to a private clinic to have, I guess, infants, babies, minors tested.
Yeah,
but do you offer
we've had some
testing for babies?
Yeah, we do some of the. Yeah, I mean, if they want to test,
How do you test a baby for
just
COVID? You shove a
same deal. Yeah,
Wow.
same deal is you got just get a nasal swab.
Wow.
And then send it off for PCR.
Poor baby.
All right.
Yeah.
But as far as you know,
It's not uncomfortable.
As far as you know, it's not a requirement that a infant get tested for COVID if they have no
It's not.
symptoms.
It wasn't a recommendation from our from the PAG that I recall, but if public health is offering, and just because they want to get tested, but about not letting them leave, I'm not aware of that. I think you guys would have to ask the quarantine test out team.
Hey, so were you able to attend the PAG meetings this week?
Oh, everything switched to Zoom, thankfully.
Right.
Yeah, I think it was a little bit with Admiral kind of closing down. And hopefully not just me testing positive and scaring everybody off, but yeah.
Right.
But it hit everybody as a good wake up call, I think.
Right.
And initially we were talking about whether or not to really go back to PCOR 1, but I think seeing the numbers rise at the hospital, I think we made the right decision.
Right, they're up again.
Move swiftly. Yeah, it's getting a little scary with the ICU numbers kind of starting to climb up again.
Right.
We have limited staffing for the ICU, and that's one thing that we just can't forget. We still have very limited hospital capacity, so if the ICU gets full, we're going to be in trouble.
Is that kind of the conversation with the PAG right now?
Yeah, it is. We're all watching this very closely, and we hear the updates from Dr. Uggan, Jolene Uggan, the ICU director. And we got flu season right around the corner. One big thing is please everybody get their flu shot this year. We have no idea how COVID's going to interact with the flu, and that's just one less thing we need to worry about. Right?
So you attended Tuesday's meeting via Zoom?
Yes, and there'll be one tonight via Zoom too.
Right. So what did you guys discuss in terms of like a home quarantine? Because I know that Dr. Hoa was mentioning that that's something that they really need to take a close look at.
Yeah, it was, without going in specific, we didn't really change much about home quarantine. We just kind of discussed, what kind of steps we need to take. So, we covered a little bit about some other types of testing. We discussed about the testing backlog. As regarding the home quarantine, there's suspicion that it's not, people aren't as compliant as they could be, but we don't really have the data to back that up yet. And so, we're just trying to, for right now, I think, PCOR 1, the first time we went through this, I think people overall did a pretty good job, but we're not really going to see the effects of PCOR 1, as you know, for like a week or two, right?
Right. So was discussions during the PAG meeting focusing on the possibility of extending PCOR 1? Because like you said, we wouldn't necessarily see the results.
We would really like to, we felt, there was the discussion both ways, right? One was, do we just kind of extend this a little bit or, be a little bit more stringent with this? Or the other side is, how do we find ways to kind of get us out of PCOR 1, maybe more to PCOR 2 kind of situation, right? But, it wasn't, we never landed on a consensus on it right now. We're going to just carry on.
Pretty sure it's a healthy discussion, right, Doc?
Yeah, these discussions, we lay it all out there.
I wish I could get in on the Zoom.
Nobody takes it personal, but there's a lot of discussion.
Yeah. Let me ask you this, Doc. So with this news coming out about the backlog of testing at public health, from that pandemic posture, right? So we had all these, over 1,500 people get swabbed over the weekend. And in your opinion, how accurate of a picture are we getting of the COVID right now if we're not running the tests?
Yeah, the community-wide testing, it really exploded, right? I think it was almost double what we've had previously. And as accurate as a picture, well, we're going to get a picture when we get the results back. It'll be a picture of 1 week ago, right?
Right.
And so that's one of the things we're kind of hoping we could kind of maybe slow down. So when we say we want to postpone the testing, it's really to let the lab catch up. We just don't have that capability right now. And we understand that, hey, getting your results even like 3 or 4 days later, not super helpful. But if we're having to wait a week later, then, how much are we really helping, right? Because we're not telling people, hey, get tested and then stay at home, don't do anything. We are in PCOR 1, so that's kind of what people should be doing anyway. But a lot of people out there are still out working, and you see the streets, people going to work and such. So, So yeah, we're trying to give the lab some time. It's as far as what I understand, the lab just gets told, hey, we're going to be doing this testing and you guys just have to do it. So, hats off to everybody at Public Health Lab that are just working their butt off trying to get this thing done. And from what I understand, they've managed to preserve the sample so none of it's going to get wasted. And, we really don't want to lose the public's trust in testing, but you're right. We just don't really quite have the capacity to run that many tests all at once, very quickly.
So I wonder at what point, like you said, when we get that snapshot, it's going to be dated. It's going to be from a week ago. So at what point do we consider throwing the baby out with the bathwater and saying, hey, everybody who got tested over the weekend, man, sorry, we got to come in. And if you want to get tested again.
Well, I mean, our test positivity rate, for our 7-day rolling average, I think is hovering around 3%. Is that right?
Let me
check. So the vast majority of people, 97% of people are still going to test negative. So that's something to kind of keep in mind. It does, with these positives that keep coming back, though, what it looks like is we probably have a lot of people out there who probably aren't thinking that they have COVID, maybe asymptomatic, maybe pre-symptomatic, but we're starting to pick it up on these community tests now that people are just a little bit more aware of them.
Right.
So, that's how we kind of get, I think that's what happened in that we did so well, several weeks ago to the point that, everyone was feeling pretty comfortable. We, myself included, we were starting to get together again, going out to the bars. And we probably had some people, who were just kind of low level positive without really knowing it. And, as we got back and started, socializing again, we started spreading again. So we did really well the first time. I'm confident that we could do it really well again. But it's just a little what's the word? I don't know, just a little bit more fatigue, I think, going through this a second time.
Right, especially having just been, like you said, in PCOR 3, lottie-dottie, we like to party, and then, boom, pull the tablecloth off the table, PCOR 1, here we are. So, yeah, it is, you're right, it's a lot to take. Doc,
I wanted to just talk about the triggers from going from PCOR 1 to PCOR 2. Was that discussed during the PAG meeting? Because when I look at
it was, so we took a look at the PCOR kind of criteria that we set back when this happened, back when we first formed it. And for the most part, there were a few things that, hey, we felt like, does this really qualify for us to go all the way back to PCOR 1? It looks like we're meeting some of these metrics that we set for ourselves. But really the kind of swing factor was, one, the hospital. Personally, for me, flu season coming up was a big factor for me. And then, just the very, very quick rise in cases was something that, really caught us all off guard. And we just did not, if it started creeping up a little bit, maybe we could just ease back a little bit first. But, it just rose so quickly that, we just really didn't want the hospital to be overwhelmed. And so that kind of overruled some of the other things. So, we got to take another look, and that's one of our tasks for tonight, to kind of look at the PCOR criteria and find one that works a little bit better for us. As you know, everything with COVID is just changes. And so the information that we have now, what we know about the virus now, is a little bit different from when we first came up with the PCOR guidelines.
The meeting tonight will be part of the discussion will be about changing the criteria and triggers from moving from PCOR 1 to PCOR 2.
Yeah, it'll be one of our discussion points for sure. It was kind of one of the big ones that we ended on Tuesday night. But it's like I said, these things, every detail we talk it out, we hash it out, and having so many physicians on, we see we get everybody's opinions, and everybody has a lot of people have their own viewpoints, so we have a nice variety of diversity of ideas to look at.
Just so our viewers,
so it takes a while.
Yeah, just so our viewers are aware of what those triggers are to go from PCOR 1 to PCOR 2. The first one is cases. Downward trend of confirmed cases and a downward trend of positive tests as a percent of total tests over a 14-day period, utilizing a 5-day rolling average. Are we meeting that, or are we?
No, we're going the other way on that one right now, right?
All right,
'Cause we're getting more and more
hospitalization.
cases.
Hospitalization. Guam hospitals are able to treat all inpatients without resorting to alternate standards of care due to COVID-19 cases. Are we meeting that?
Right now, the hospital, I believe, is meeting that, but it's, you know, like I said, the ICU is starting to fill up, and we're getting more. I think last count I saw, we had maybe 14 COVID patients.
I want to say 17,
I think it
Doc.
was
Yeah, there was
17.
an increase yesterday.
Has it gone up already?
Right.
Yeah.
And
so,
GMH is looking
you
at
know.
establishing a COVID Care 4 unit.
Right.
All right, testing. This
Yeah,
is the
and-
other trigger. Guam has the capacity to test all people with COVID-19 symptoms.
with symptoms, I believe we do, actually. You know, what we're getting a lot of testing from the community right now is, you know, people without symptoms and people without established exposure. But people with actual symptoms and positive contacts, I think we do. But, you know, we are also getting a lot of people who just want to get tested just because, right?
So
A
we're
lot of
able
them
to do the
missed out on
tests. We're just not able to run them through public health.
Right.
Okay, contact tracing. Public health has the capacity to conduct adequate monitoring of all COVID-19 cases and tracing of their contacts with one shy of 600
believe-
confirmed cases.
I believe we do. They're all working really hard. I know I was getting a call twice a day from the contact tracing team, and I was really impressed at you know, the level of thoroughness. I thought they were doing a really good job. Dr. Kanashiro would be the best person to ask about that. I know that they're all working really hard, and the governor pledged to hire more contact tracers, but I think we're doing a good job there.
So having said what you said, do you think we're ready to move into PCOR 2?
I don't think so yet. I think we really need to see the cases start going down. I think we want to see the hospital census start to ease up a little bit. Like I said, we're right around the corner from flu season. The GMH has already started to diagnose people with the flu. So, you know, it's just, you know, I read an article about the CDC talking about how, you know, the second pandemic that they're calling, you know, COVID and flu, right? So, you know, we know flu, you know, wreaks havoc every year, and it fills up our hospital by itself. And so now we're doing that with COVID, and you know, that's the big danger with COVID. It just you know, increases the patient load, and our hospital is not elastic, right? We're you know, we have fixed amount of space.
Did you have any?
I wanted to ask about face-to-face learning, but maybe it's too soon now that you just shot down. We're not going back to PCOR 2, so.
It's not ready yet, but the few reports I've been seeing, you know, it looks like it's the employees that are testing positive right at the schools. And that's kind of the big concern that we all had, right? I wasn't really, yes, we kind of think about the kids going back, but really if this gets into the schools, it's probably going to be from the adult staff who spread it and then spread it down to the kids. So yeah, I'm glad that everybody's taking the safe precautions right now.
Doc,
Go ahead.
Are you good? Because I was going to say what?
Oh no, I was just going to say, you know, what were you taking while you were?
Were you taking disinfectants with your coffee? Hydroxychloroquine, lemonchino? We heard.
No. All I did was, you know, I took a little bit of Advil for the first couple of days for the aches, and really that was it. You know, just a lot of rest, a lot of fluids. I had a friend drop off some like fresh squeezed orange juice, which is great. I couldn't taste it, but I could tell it would have been delicious.
Right. Yeah.
You know, but really it was just a lot of rest. And
Okay.
really, you know, you just wait.
Yeah. It's a waiting game. Thanks, Doc.
Thank you,
Man,
Doc.
appreciate your time. Really good insight.
All right, guys. It was good to be on.
All
Yeah,
right,
always.
stay
Okay.
safe.
And are you guys doing testing in One Love? Is that ongoing? Is it an option for people?
It is.
Okay.
It's by appointment only. I think this morning's schedule or today's schedule looked a little bit full, but you know, if people want to get tested, they should take a look. Yeah, we had a lot of, like I said, if it was just people who only had symptoms or only had positive contacts, it'd be pretty easy. But people just want to get tested now.
Right.
Because they missed out, so.
And this is what we wanted. We wanted people to want to get tested. So here we are.
Yes, that's true. Yeah.
Okay, Doc. Thank you, Doc.
Take care.
Wash
All
your
right,
hands.
thank you, guys.
Okay.
Yeah, absolutely.
Okay.
All right.
There you go, Dr. Michael. He wears many hats. I'm surprised he doesn't have 3 heads. He's a pediatrician with One Love Pediatrics, of course, also on the Governor's Physicians Advisory Group. We got to take a quick break. Quarantine facility at the airport. Sense or no sense? We'll talk with Gura director Ray Tapasnia next, right here on The Link. It's The Breeze 93.9. Good morning, Guam.
In this time.
Whether it is tablets for children, special equipment for special children, or coral reef research, federal support is critical for our schools and our future. This week, we're trying to open schools. Parents are worried about their children's safety. Teachers are being asked to work minor miracles every day in teaching without looking directly into the eyes of our children. We must make sure that every child has a tablet, can get online, and get on with their education. We need a congressman who understands education and how the federal government can support every activity in the classroom, in the laboratory, and in the internet. Now more than ever, we need a congressman who will assist GDOE, UOG, and GCC without hesitation in solving problems with federal agencies. It's time that your child takes center stage, not only in school, but in Washington, D.C. I'm Robert Underwood, and I approve this message.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
You live life on the go, and now so does your mortgage application with FHB Digital. It's easy and fast, with features that gather your documents or make it simple to upload them yourself. FHB Digital provides personalized mortgage options to suit your budget. And if you have questions, just ask a loan officer. FHB Digital. Bank at the speed of your life with First Hawaiian Bank.
Half a day. I'm Dr. Jana Manglonia, Medical Director for Public Health. We all play a role in slowing the spread of COVID-19. We must continue to stay strong and practice everyday preventive actions to keep our island safe. Maintain a distance of 6 feet between yourself and others. Wear cloth face coverings in public settings. Wash your hands for at least 20 seconds. If soap and water are not readily available, use alcohol-based hand sanitizer that contains at least 60% alcohol. Clean and disinfect frequently used surfaces. Avoid touching your face. Stay home if you're sick. Let's protect ourselves, our loved ones, and our communities. Prevention saves lives. For more information, please call 311 or check out our website at dphss.guam.gov.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6. Yeah, they don't make them like this anymore. Good morning. Good morning, KUAM. Ha! It's the link on the breeze, 93.9. Good morning, Sheila. Hey, Kevin, good morning. Marcy Duenas, thank you for joining us. Fausto Rivera, good morning. Bill Taku, good morning on you. It's 7:51. Let's go back to the KUAM News Zoom room, where we have the Executive Director of the Guam Housing and Urban Renewal Authority, Mr. Ray Tapasnia. Good morning, Ray.
Good morning, Chris. Good morning, everyone.
Let's just start with this quarantine facility at the airport. Now, this is something that you said it had come up in a board meeting.
Yeah, I was just briefing the board that we had discussions with public health on two separate projects. We proposed to build a passenger quarantine facility at the airport. It's something I had proposed back in 2013. It didn't get any traction, unfortunately, but maybe now's the time to build it. The other project we've been talking to public health about is trying to give them more capacity by giving them a BSL or a biosafety level 3 lab. And unfortunately, the environmental lab up in Derrida was built back in 2016. I believe they cut the ribbon then. And even today, there's major issues with that lab. It's not CDC certified at BSL 3 level. So, we'd like to help public health get it to that point and hopefully give them some more capacity.
What with the federal monies, or how would you guys be able to pay for the quarantine facility at the airport and then, the upgrades of the lab?
Well, we can't use our own money, but we do have the technical expertise. So what we've offered to them is if they're able to find the money either through CARES Act or FEMA, we wouldn't mind taking the lead in getting the bids out and overseeing the construction to the point where both facilities are CDC certified.
If you could, Ray, give me some visuals to work with when you talk about a quarantine facility up at the airport to be built. Like, where would you think it would be? How big of a facility are we talking? Beds and showers, like the Japan airport, or what?
Exactly. The top 20 airports in the U.S. and Guam's airport is actually ranked in the top 20 in terms of international arrivals. The top 20 airports have the capability, have the capacity to say, for example, if a flight was coming in, and I know a flight came in the other day where they had to quarantine the entire aircraft.
Right.
We should have the capacity to do that, and unfortunately we don't. That's what I had proposed back in 2013. Of course, in all fairness to the powers that be at the time, nobody anticipated COVID-19.
Yeah.
Today we should stop talking about it and let's move forward and try and build this, and as well help public health get a BSL 3 level lab so they have more capacity. So that's where we're coming from. We can't use our own money. We're restricted using our own funds, but we certainly have the technical expertise to build it.
Why did we build a lab that was not what did you say, BSL certified?
It was intended to be biosafety level 2 and 3 certified, and unfortunately, and I'm not going to speak to the previous administration, but or why they didn't get it certified. But when we took the helm, when the governor actually toured the facility, it wasn't compliant to what it was intended to be, and we spent, I think, $2.6 million of Department of Interior funds, and it was never certified. It's going to take another $1 million, we believe, to get it to that point, and all we're doing is offering to help to assist them.
Do we have to pay back the federal money that we received to build that lab?
No, I don't believe so. Again, I wasn't the executive director at the time. They have a building and it's fully occupied. It's just not able to test at the capacity we'd like them to test.
Right.
What about, I wanted to switch over to Guma Tranquilidad. I know that there's scheduled testing for residents there today, right? Is that still going forward?
Yes, it's at 9 a.m. today. In fact, when I'm done with this, I'm going to head down there and try and encourage most of the residents, all the residents, hopefully, to test it. Last time there was a positive and we had them tested. We didn't get 100%, but we got, I think, about 38 of the 49 residents tested. And most recently, and I'm probably not supposed to say this, but most recently we had another positive. So that's the reason why we requested for a second round of testing.
So this is the second positive case at Guma Tranquilidad. When was the first case? Because we were never told about this.
I believe back in April.
Mm-hmm. And what happened when you guys had that positive case back in April?
We had a positive case, and the individual was immediately, and we had to oversee this. The person was immediately transported to a isolation facility so we can protect the other residents down there.
Mm-hmm.
We've recently had another positive, and we're having everybody tested. Hopefully, everybody this time around. And I'll be there. I'll get tested as well. I got to lead by example. Hopefully everybody follows suit.
Is there any indication how this second positive occurred?
We have no clue. I'm leaving it to public health to do their contact tracing.
Mm-hmm. Are people allowed to go and visit people over there at public health? I mean, at Guma Tranquilidad, or did the individual that tested positive? It's one of the residents, right? It's not a staff member.
Correct.
Mm-hmm. So,
well, what we've done is we've closed down the common areas to include the laundry facilities, the social hall, so that they're not able to congregate. I'm sure they're not happy about that, but we had to take precautionary measures. And then, aside from those common facilities, they have their own independent quarters. So, we believe the risks are low, but nonetheless, we want to get everyone tested so that we can sleep good at night.
Right. How old is this individual?
I believe maybe in his 50s.
50s. Oh.
I'm probably going to get in trouble for saying that, but.
No, you're not. Yeah, you can say that.
The first person that had tested positive, are they back at Guma Tranquilidad?
Yes, they've been cleared to return.
Mm-hmm. And the second one, are they at the government isolation facility?
No, I believe he may be at the hospital.
I see. Wow. Okay.
Ray, what was the reaction from the residents, back when we had this positive in April and now?
Well, keep in mind, as long as we restrict them from the common areas, they're pretty safe. They're within their own units. Yeah. There's bathroom facilities, there's kitchens. They have everything they need. It's the common areas that we had to cordon off and make sure that they're not congregating. So we feel we've done everything humanly possible to ensure their safety. The next step was getting everybody tested.
Mm-hmm.
Right.
But yeah, I'm pretty confident they're okay.
So nobody else is exhibiting signs or symptoms?
Not that we're aware of.
Right. I mean, that's tough, Ray, because obviously, I've been down there, and they like to talk and come out in the morning and drink their coffee, and and obviously them being Manumco, that interaction is pretty key. So,
absolutely, absolutely.
Let me get in here, guys, real quick. Hey, to our viewers on KUAM TV8, good morning on you. We are KUAM FM in Hagatna, Guam. Thanks so much for watching. The link on the Breeze 93.9. Remember, we'll do it again tomorrow morning on KUAM TV 11.
Yes.
6 a.m. to 8 a.m. If you guys want to jump over to our KUAM News Facebook live feed, of course, we're also on the Breeze 93.9 FM on the radio. We're currently interviewing Gura Director Ray Tapasnia, talking about a couple positive COVID-19 cases, one in April and the other one more recently at Guma Tranquilidad. So thank you to our viewers on KUAM TV 11. We'll see you on the Facebook live feed. Hasta Dios.
Ray, when did this individual, the second individual, test positive?
I believe it was 2 weeks ago, or a week and a half ago, maybe.
Do you know if he had family member that was visiting him?
Again, we're not privy to that because we're not part of the contact tracing team, but I wish we were.
Right.
Ray, so in PCOR 1, are there any restrictions other than closing the common areas that you also put in place at Guma Trinculadot?
Well, of course, we've completely, aside from limiting the common areas, they're not allowed. I mean, we've completely banned any kind of activity, right? So they can't. The only ones that can visit them are their immediate family and those that are authorized, caregivers. Aside from that, there's very strict regulations down there. But as far as the overall Gura operations under PCOR 1, we've restricted any in-person interviews and any walk-ins, but all essential functions continue to move forward. So.
Right. Ray, let's, because I know there was a couple other things you wanted to touch on before we let you go.
Yeah, our audit.
There you go.
First time in 30 years. This is our best audit to date. We had a unqualified opinion on financials and a unqualified or unmodified opinion on our on 4 major programs. That is unprecedented. We've had a history of audit findings. The audit, our team here addressed 24 prior year audit findings since last year. So, my hat's off to the career staff. I think we've done a good job of trying to turn our image around after all the chaos of the past. But, it's the best audit we've had in 30 years. We're proud of it, and we hope to continue to have clean audits moving forward.
Ray, I know that you're also a part of the Interagency on Homelessness, correct?
Correct.
Have you heard anything on the results from the testing of homeless people that are up at the global dorms? The results?
I haven't, but if I can just share with you that there's so much progress, and we actually meet weekly. We have another meeting at 11 o'clock today, so I have the 9 o'clock Guma Trinculadot testing. Then right after that, I got to zoom into the Interagency Council meeting at 11. But basically, as you know, we have, I believe the latest report was about 80 some individuals up at the shelter, at the emergency shelter. As well, Gura is moving forward with, and I've been giving the council weekly updates on this. Gura is moving forward to try and find more permanent housing for the residents that do qualify. And so we have as many as 5 that we should be providing some kind of transitional housing to, and hopefully that transitional housing will proceed towards permanent housing. But 5 persons with disabilities will be able to house within the next few days. We're just awaiting some documents from DISIT to get their proper certification. Of the 5, 2 of them or 3 of them, I believe we already have identified a facility. So, it's not just providing emergency shelter in connection with COVID, but trying to get them a more permanent housing so that, we can protect them from not just infectious disease, but just from the environment. So,
we did speak with the Salvation Army just yesterday, I believe. And they talked about the partnership with the Gura in providing this rapid rehousing for families and individuals over at the Global Dorm.
And we also have a whole bunch of stuff coming down the pipe. We're just waiting for final approval, and we might get that by as early as this Friday, and I'll report that to the council today. But we have a mortgage relief program in partnership with the Guam Housing Corporation. So as many as a little over 200 plus mortgage holders from primarily low-income families will be able to cover about 3 months of their mortgages. So, there's just a whole bunch of stuff, but HUD gets upset at me when I talk too much about it in the media, and they haven't actually signed off. But that's one of the things that we're doing with our CARES Act money.
Okay. Well, I'm sure we'll be able to get you back on when you're able to
Yeah.
disclose
Yep.
how people can take advantage of that. So thank you so much, Ray.
Yeah,
I know
Ray.
you got to go, so stay safe.
Hey, keep us posted on the testing and all that stuff, man.
Will do.
Okay, thanks,
Okay.
Ray.
Bye, Ray.
Okay, stuff. Wash your hands. 8:06. We'll take a short break, and then we're going into quarantine. Okay.
And do some news.
Yeah, and we'll do some news. It's 8:06 again. This is the link on the breeze 93.9. Good morning, Guam.
Are you concerned? Coming up, former Second Lady Jill Biden joins us to talk about getting voters motivated to vote for her husband. Plus, we'll look at the growing crisis facing students this fall as part of our special series, School Matters, coming up on CBS This Morning.
Whether it is tablets for children, special equipment for special children, or coral reef research, federal support is critical for our schools and our future. This week, we're trying to open schools. Parents are worried about their children's safety. Teachers are being asked to work minor miracles every day in teaching without looking directly into the eyes of our children. We must make sure that every child has a tablet, can get online, and get on with their education. We need a congressman who understands education and how the federal government can support every activity in the classroom, in the laboratory, and in the internet. Now more than ever, we need a congressman who will assist GDOE, UOG, and GCC without hesitation in solving problems with federal agencies. It's time that your child takes center stage, not only in school, but in Washington, D.C. I'm Robert Underwood, and I approve this message.
You live life on the go, and now so does your mortgage application with FHB Digital. It's easy and fast with features that gather your documents or make it simple to upload them yourself. FHB Digital provides personalized mortgage options to suit your budget. And if you have questions, just ask a loan officer. FHB Digital. Bank at the speed of your life with First Hawaiian Bank.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
We got your 6.
At 6 a.m. with the link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Half a day. My name is Kathleen Fernandez, and I'm a registered nurse at the Department of Public Health and Social Services. The Centers for Disease Control and Prevention recommends wearing cloth face coverings in public settings. Don't let your guard down. Prevention saves lives. For more information, please call 311 or check out our website at dphss.guam.gov.
Put your trust in me. Just say the word, what it is.
a day. Nadine Alana. Dude, I love this song. I promise not to hurt your heart. I swear I'm not able. My love's on the table. It's right there next to the Finadeni. 811. Good morning, Guam. Good morning, Guam. Ah! Welcome to the link. We're here for this. It's The Breeze, 93.9. Sabrina Salas, Matanani. My name is Chris. And, hey, remember, you guys can reach out and touch us, 637-0094. That's our phone number. Coming up, we have Rear Admiral John Manoni at 9. We'll get Public Health 9:30. And we've got Attorney Tom Fisher coming up here in a little. But first, let's go ahead and jump into news with our link update from the KUAM News team. Jason Salas, good morning.
Hey everybody, Jason Salas here, and here are your link headlines. Another jump in positive cases brings the island total to 599. According to the Joint Information Center and Situation Report, 22 new cases out of 524 test samples were reported. Of those new cases, 9 were from public health, 9 tested positive from diagnostic laboratory services, 2 tested positive from GMH, and 1 both at Guam Regional Medical City and American Medical Center. These cases are under investigation. To date, there have been 5 deaths in our island community with 363 people released from isolation. There are currently 231 active cases with 17 people currently hospitalized. Of the 599 cases, 525 are civilian and 74 being military service members. Community testing continues today for residents of Guma Tranquilidad in Tuman. On Saturday, community testing will be from 9 a.m. to 12 noon in Jotnya at the St. Francis Catholic School. Well, the clock is ticking for the legislature to pass the fiscal year GovGuam budget, as senators have not been able to meet in the Congress Hall because of a coronavirus-infected employee. They've instead been holding virtual meetings on the Committee on Appropriations. Discussions got bogged down Wednesday over a motion by Senator Jim Moylan to adjourn the committee meeting and go back to a face-to-face session Monday. Now, after lengthy debate, Moylan decided to withdraw that motion. Several senators pointed out a budget bill can only be passed on session floor, and further changes can also be made. By law, the legislature has until the end of August to pass a new budget. Well, the Guam and NMI delegations cast their virtual votes in the DNC. Making the announcement for Guam was Sarah Thomas Nedadog, the party chairperson. And for the recently revived Democratic Party in the Commonwealth of the Northern Marianas, it was chairperson Nola Hicks.
Guam. 70 years ago this summer, Chamorros became U.S. citizens. We are proud of our resilience, proud of our indigenous heritage, and proud to be part of this historic moment for our party and our nation. From the land where America's day begins, Guam cast 2 votes for Bernie Sanders and 11 votes for our next president, Joe Biden.
Northern Mariana Islands.
Half a day, T-Row, and hello from paradise, the Northern Mariana Islands. We may be far away, but we're American citizens. And this year, for the first time in decades, we finally have a Democratic slate. Because Democrats organize everywhere. But we don't get to vote for president, so please don't waste yours. The Northern Mariana Islands is proud to cast 2 votes for Senator Bernie Sanders and 9 votes for our next president, Joseph Biden. Sidus Ma'asi, Olamai, and thank you.
The Democrat National Convention continues through Friday, airing live from 11 to 2 on KUAM. Local fishermen be advised, effective today, federal law prohibits any activity within a 2.3 square mile area, extending the high tide line in the waters below the Finnegadson Small Arms firing range. It's been designated a danger zone. The announcement was made by the Department of Agriculture on behalf of the U.S. Army Corps of Engineers. The firing range complex is being built for the training of Marines relocated from Okinawa. Local activist groups such as Protei Letexan and Save Retidian have opposed the range complex, citing destruction of ancestral sites and environmental damage. That is the news for tonight. Now let's get back to more right here on The Link.
The Department of Public Health's lab is having a hard time keeping up with the massive amount of testing that's being conducted. According to the Joint Information Center, as a result, those that underwent testing can expect delays in getting the results. Public Health Director Art St. Augustine says getting patients accurate and timely results remains a priority for the department. He adds patients can expect to receive the results within 7 days. The most vulnerable, including healthcare workers and those who are close contacts to a positive case, are prioritized. The JIC did not provide any information as to how many test samples remain waiting to be ran through Public Health's lab. If you don't get your results within 7 days, you can call the Northern Region Community Health Center at 635-7525. Public Health, in the meantime, has postponed this Saturday's community testing that was scheduled for Jotnya. The agency is reaching its capacity for storage space for specimens and will need more time to be able to run the remaining tests as efficiently as possible. Public Health says that the specimen samples are properly stored and preserved. Public Health, in the meantime, is planning to clarify its guidelines and requirements for quarantine and testing for minors and infants. According to Public Health's guidelines, it only recommends that children 5 years and older be tested for COVID-19 if necessary. The issue surfaced after a Guam resident returned to island last Thursday with her 10-month-old baby. Christina Leon Guerrero says that she was waiting for test results, which returned negative on Saturday. 5 minutes after being given the all-clear Saturday to leave the government quarantine facility to go on home quarantine with her baby, she was then told that her baby needed to be tested for COVID-19. Public Health spokesperson Janella Carrera acknowledges the guidelines need clarification, but states there is an alternative for Leon Guerrero to have her baby be tested at a private clinic of her choice. Carrera added that if she is able to provide verification of the appointment, she and her child can be released on home quarantine. Whether, in fact, however, infants need to be tested is unclear. Carrera stated, at this time, there really isn't a clear definition when it comes to age of testing. The Public Health spokesperson added this is an issue that is being discussed to clarify the age restrictions, the thresholds for the limitations on age for quarantine, and what age do we require COVID-19 negative results for the quarantine of minors. Christina, in the meantime, has scheduled an appointment for her baby to get tested, saying that if that is what she needs to do for her and her baby, she'll do it. But she urges Public Health Director Art San Agustin to be more vigilant when these rules and memos cross his desk before they are publicized, to make certain without a shadow of a doubt that what they are asking of island residents is concise and consistent. 2 more police officers tested positive for the coronavirus. This brings the total number of police officers in the past couple of days that have been infected with the virus to 4. The 2 positives reported earlier this week were assigned to specialized units. One from Wednesday was also assigned to a specialized unit, while the other was assigned to GPD's Administrative Services Bureau. Police spokesperson Paul Tapau couldn't say how many officers may have had contact with the positive cases, but assures the community that GPD is making the moves necessary to cover down. All 4 officers are in home isolation. The Federal Election Commission has put Congressman Michael San Nicolas on notice in a letter dated August 18th to the Congressman's campaign treasurer. It states that it has come to their attention that they may have failed to file their pre-primary report for July and August. The campaign has been given 4 business days to file the report. The letter from the Federal Election Commission states failure to timely file this report may result in civil penalties, an audit, or other legal enforcement action. According to the FEC website, Democrat Robert Underwood and Republican Will Castro have filed their reports. And that is your news.
Thank you, Sabrina. It's 8:19 on the link. It's the Breeze 93.9. Let's go to our KUAM link Zoom room where we have Rob standing by. Just to give you guys a little background here, Rob is currently serving his sentence in quarantine, but Robin will bring you on, and we're starting on a light note, but really your story, I just can't believe it. I can't. It's mind-boggling. Let's just start from the beginning. Obviously, you were an inbound. You're a returning resident to Guam, right?
Yes.
Yeah, and so just tell us where you came from. And when did you come? And just bring us, give us the history up to where we're at today.
So I'm actually coming in from New Mexico, which is a low-risk area. I had 2 tests conducted for COVID-19 before I arrived on Guam. Both test results came back negative. Unfortunately, I happened to be one of the passengers that so happened to be on the Honolulu flight 201 that had the positive COVID patient, where they quarantined the entire flight. My reason for returning to the island was the fact that I'm on emergency orders for the death of my little brother, who was Jose Sanchez, the 22-year-old spearfisherman who died recently. once I got there or arrived to the island, they let us know that there was a positive patient on the flight. However, we had the hardship paperwork. We were verbally told, and it states on their paperwork that we were to be tested 24 to 48 hours within being administered into the quarantine facility. And it's now day 8 of me being in here. And they have denied us the testing for the 24 to 48 hours. I then contacted public health and I asked them, what about the 7-day option that is clearly laid out in their protocol that they have shown everybody, and they have denied me that as well. They are under the assumption that we are, has labeled us as a high-risk personnel. However, they have denied us testing. They don't want to test us until day 12 to determine whether we are even COVID positive or not. So we are being held in here under the assumption of positivity.
You said we. Who else are you with?
I am here with my spouse as well.
And you've been feeling okay? No signs or symptoms or anything?
No signs, no symptoms. They've been taking our temperature, which is the most interaction we get with the nurse here, every day, which we've been consistent 96 to 97 degrees every day.
And who have you called anybody? You've called public health and what was their reason?
Public health, I've contacted the social workers. I get all the same info. You guys were in close proximity, which, they're labeling as 3 rows forward, 3 rows back into the side of the positive patient. And it's the same story every time I call them. You were in close proximity, you have to stay.
And that's
it.
Did they give that to you in writing?
No. There's nothing in writing. Everything's done via a phone call that I received to my room.
Rob, when is your little brother's funeral?
His funeral is this Saturday on the 22nd. And they called me yesterday, asking me if I wouldn't say asking me. They gave me 2 options for my family. It's either A, they push the funeral back, or B, they set up a Zoom call so that I can attend the funeral, because we're not leaving anywhere is what they told me.
They told you to push the funeral back?
Or get on a freaking Zoom?
Yeah, that's basically what they told me yesterday on the phone.
This is public health.
The injustice that's happening here it's ridiculous. It's beyond ridiculous. They have protocols that they set for with all the guidelines that we have followed to the T before we arrived here, and they themselves aren't even following their protocols.
Rob, let me play devil's advocate here. What would you say to those people who hear this and say, hey, he was within close proximity of that positive passenger, that's why he's in the quarantine?
So, if people want to say that we are in close proximity, then allow me to test. Why are we going to go to the full extent for the 14-day quarantine without testing me to, make sure that I am an actual positive carrier? Because if I'm a positive carrier, then yes, the 14-day quarantine and isolation away from my family would make sense. But putting me in a 14-day quarantine under the assumption now of being a positive carrier is ridiculous. They have denied me the testing because they are assuming that I am a high-risk potential carrier now because we were within close proximity to a positive COVID patient.
Rob, I can't even imagine. I mean, I just can't. You coming all the way from New Mexico to bury your little brother, and just to have to deal with all this. Can you just tell us what's going through your mind?
I mean, so there's so much going through my mind. I mean, a lot of it is aggravation and the sheer fact and thought that I will never get to lay my brother to rest personally, only through a Zoom call is what they're saying that I'm, that they want me to do, which is crazy. But, a lot of it is aggravation because I'm not getting any help in here. Nobody calls us to keep us updated on what's the way forward. And when you try to contact public health, you have to call, 7, 8, 9 times just to get somebody who gives you the same answer, because nobody wants to reach in here into the quarantine facility and help out those that are in here.
Which
They
quarantine?
basically locked us in the room and threw away the key.
Which quarantine facility are you in?
I'm in the Ocean View Hotel, Ocean View, Bayview, something like that.
Right, yeah.
What's your family saying? You spoke to your family that are here?
Yeah, I've spoken to my mom, and she's hurt even more now because she just lost my little brother, and then on top of that, she has to worry about me being in here, not being able to attend the funeral and be by her side to bury my little brother. It's breaking her down even more. And we're not getting any compassion from public health at all. We filled out the hardship paperwork, which is in their guidelines. And basically, we've given them everything all the way up to including my brother's death certificate, because they requested all that information, only for it to be thrown in a drawer somewhere and left.
Is your wife also from Guam?
Yes, she's also from Guam.
Well, I just texted the director. Have you spoke to the director? Your family's just kind of going off in the comments here, Rob. They're saying, the governor said she can't do anything because it's not her department. We've got another one, Teresa. Teresa writes, test them and release them. Rosemary, get Janella on the phone now to explain this. People are saying it's insensitive. Jay Augustine writes, funerals in 2 days, public health. My cousin did the due diligence. He was cleared negative COVID in New Mexico, brought the official testing documents. And we get that, right? And then so there was exposure on the plane. And all you're saying is, hey, if you think and you want to assume I'm a positive case, then put your money where your mouth is and give me the test.
Exactly. I mean, we've been requesting the test, from the day we got in here, because we were told 24 to 48 hours, and we were left in the dark for 3 days, 4 days. Then they call us back and say, hey, you guys are considered a high risk now, and you would have to stay and more to come. And then I had to call back on the 5th day trying to figure out what's going on, because nobody told me anything. And then now they're saying, hey, you got to do the full 14 days because you're high risk, but still no testing. I requested a test on the 7th day, which is their option, like I said, and still have been denied that option too.
Yeah, Rob, unfortunately, we keep hearing these quarantine horror stories where people understand that this is something that we need to do as a community to keep ourselves safe. So you're sitting here, you're saying, yeah, I understand what this is all about. Give me the test. And we just heard from Christine Leon Guerrero, who's also in quarantine with a little baby. She was set to go, and then all of a sudden it's like, no, you got, the protocols, it just cannot be that the only people following the protocols are the people who are in the quarantine.
Yeah, exactly. Like I said, the quarantine facility, there's a lot of injustice that's happening in here. And it's like public health just doesn't really care for the people in here. They locked us up here and we're good to go because, they feed us food and give us water every day. But that's about it. We can't leave the room. We've been isolated in here for 8 days now with, nothing. And it's absurd, when you try to reach out and get information about your case from public health, and they just themselves don't want to help.
Rob, say I'm the director of public health. What would you say to him right now?
If I can reach out to the director of public health, I'd tell him right now that you need to get into the quarantine facilities and look at everybody on a case-by-case basis and actually do your job at testing everybody. Don't just make a blanket case of, oh, you guys are potential high risk, we'll leave you in there for 14 days. You need to see it on a case-by-case basis. Everybody is different. You can't just assume that people are positive because they were in close proximity to somebody.
I got it, Rob. How hopeful are you? I mean, keeping track of you on Facebook. I know it's just so hard, and optimism, I don't even think that's the right word to bring into this conversation, but they're going to put your little brother to rest on Saturday. It's Thursday.
Yeah.
And you flew all this way to say your final goodbye. Tell us about
your little brother.
Yeah.
So my little brother, I mean, you guys have probably seen in the papers, he was a great fisherman. You know, I taught him everything that he needed to know. When it came to spearfishing, he loved the water. And unfortunately, he passed away doing what he loved. You know, it was an unfortunate tragedy that happened while he was spearfishing. But, you know, he was a good young man who was real passionate about spearfishing. And I'm glad that he passed doing what he loved. And it's unfortunate because, you know, we were so close, and it's unfortunate that I flew all this way, and I'm not going to be able to lay him to rest in person because they want me to do a Zoom call.
I can't make sense of this because we're granting exemptions for people to go to funerals. You're right. It just really seems inconsistent. And I mean, I know public health listens, and I just don't get why it always looks like there's one set of rules if you're, in or you're
For certain
connected.
people.
Right. And people can just freaking waltz right from the airport just because they've got some kind of exemption.
Yeah.
And I mean, I get that, I get that the plane and there was exposure and they need to quarantine you guys. But again, they give you the option to get tested out. Have you tried to or talk to public health about getting maybe a private doctor to come to the facility and test you?
I have not spoken to public health in regards to getting a private doctor to come to the facility. But, you know, we were being told that, you know, they're testing everybody, basically trying to test everybody, if you will, every day. Right. But no one has come up to our room because we were labeled, you know, a potential high risk. But, you know, we had neighbors here who were also on the same flight as us, but they were labeled as a low risk, which makes no sense, and released out of quarantine without even testing to go home. You know, and that's what I'm saying. Like they're under the assumption that we're a positive COVID carrier now, but they don't even want to test us. They just want to hold us here until the 14 days and not administer a test within the 7 days, which is what their protocols clearly stated.
Did they tell you like how close you were to this positive case? Did you say
no,
3? So you don't
they
even
just
know.
keep telling us that we were in close proximity, but they don't give us. They never gave us any information of where he was sitting or anything like that.
Right. And so these other passengers, I mean, even if let's assume that they weren't within the 3 rows back, 3 rows forward, I mean, they could have easily walked by the positive case on the way to the bathroom, or pass them a pillow, or.
Yeah, I mean, you know, I pleaded my case when it came to that because we were all in an aircraft together. You could have walked past them, as you said. We've all stood in line to get our baggage at the airport, still not knowing who this person is. We all stood in line to process through customs, still, again, not knowing. And then they bust us all to the quarantine facilities.
Well, this is just terrible, Rob. I don't even know what to say other than this just really pisses me off.
Yeah.
I mean, this is just unreal.
It's the injustice that's happening in the quarantine facilities. It's ridiculous. It is beyond ridiculous right now.
Well,
Rob,
hopefully the director is listening.
Well, I just texted him. He's going into a Zoom meeting, so I thought he was going to jump on this Zoom. I should have sent him the link. Yeah, but, we're going to definitely get the director involved. Man, the problem is public health is, like, backed up. I mean, we're hearing hundreds of tests that they swab from people over the weekend. So if they get you tested, I'm just worried. Let's say that, they see this, that, okay, he's filled out, he's done everything he has to do. Let's go give this guy a test. I'm just worried that it's going to get lost with those 5 million other tests that we haven't run yet.
Yeah,
So-
but public health, I think they do have the capacity to do
The
rapid
rapid
testing.
test, especially since they're saying you came into close contact
GMH has
with a
the
positive
ability?
case, right? And I believe that's the protocol. When you come into close contact with a positive case, you get the rapid test, which is like
as
15
per
minutes.
the CDC website, when I did my research, the CDC website clearly states that if you were in close contact to a confirmed positive case, that you should have been tested immediately.
Right.
But as I said, I'm on day 8 in the quarantine, and we have not been tested. We have been denied the option to test on our 7th day and finish off home quarantine. And we've been here since August 12th, and the most we've ever seen our family is, about over 200 feet away when they're waving at us at in a parking lot.
You're thinking about your mom, Rob, and how much she needs you right now?
All day, every day. I call her every day trying to see if she needs help with anything. I'm trying to coordinate what I can for the funeral while being in here. So everything that I'm trying to do to help my mom is being conducted through a phone.
Are you the only sibling?
I'm the only boy now. Yes.
So you're the oldest son, and we all know in our culture the oldest son is. I mean, there's a lot of responsibility on you.
Yes. And that, that's one of the main reasons why I flew back to Guam as early as I did, so that I can help my mom to prepare to lay our brother to rest.
Well, Rob, I mean, we're putting this out there. People are hearing it. I know the government of Guam is listening. Let's get this guy tested, and not just him. There are other people. I hear the stories all the time. Other people, maybe they don't know somebody, and they're just, it's like a jail sentence. And we understand that, the intent of the quarantine is to keep us all safe. But don't put these protocols and guidelines in that are meant to, allow people to go to funerals, allow people to, recover from surgeries. And we put in and then you basically turn a blind eye and a deaf ear to this guy who's here to bury his kid brother.
Mm-hmm.
You're in the military? Because that's what people are saying, that you're in the military?
Yes, I'm active duty military, serving in New Mexico right now.
Mm-hmm. You're not able to get tested, I guess, at Naval Hospital?
So,
well, you can't even get tested. You can't even leave.
Yeah.
Well, I've reached out to the military to see if we can at least be transferred to them into their custody so that we can quarantine with them and potentially get tested from, Naval Hospital.
Right.
They've done everything that they possibly could. However, public health has not gotten back to give them the green light to come and get us.
Well, we're getting the Admiral on in 20 minutes, so
yeah,
we're going to take this to the Admiral. I mean, are you I don't even know if he's Navy.
You're Navy, Air Force?
I'm in the Air Force.
Okay, right on. Rob, I mean, in closing, I think you've said it all, but is there anything else that you want to put out here for your family, your friends? They're all watching right now.
Yeah, the only thing I want to, I would like to end with is, please, I hope that public health hears this message and they actually start, reaching out to those that are in here, because, I'm not speaking on just for myself, but on behalf of everybody else that's in quarantine who are possibly going through the same treatment as I am. The injustice that's going on to them, needs to be corrected from public health, because as we are being told, public health is the know-all, say-all on releasing us from these facilities.
Right.
So that's what I would like to end with. I want to thank you guys for allowing me the opportunity to speak out and get my voice heard for everyone that's in here in this quarantine facility.
Right, Robin. That's why we wanted to get you on, because you got a great voice, and we just want more people need to hear. And every time we get one of these horror stories, we throw them on, and I don't understand why we keep getting these stories to put on. And this is just our condolences, Rob, to you and your family.
Thank you.
And keep us posted, okay? You got my number. We'll get a hold of the director and give him a hard time.
Will do. I appreciate everything that you guys are doing for us. Thank you so much.
Thank you,
Take
Rob.
care, Rob.
God bless you and the family, and God bless your mom, okay?
Thank you.
Okay. Right on. If you have a quarantine horror story, don't hesitate to direct message us. Put it in the comments. I mean, I get messages all the time. I mean, I just had one where a priest, I mean, this is a priest, not a priest in the same hotel as Rob, sent a video of right when he checked in. Bed sheets, blood stain, little blood stains, hairs. And these hotels are making money. But, Lanit, are they sanitizing the room in between quarantines? Or because it doesn't seem like it at all. And this is just...
Yeah, Christine, she won't even let her baby on the floor because the floor is just disgusting.
Yeah, 8:41. Well, we're going to take a short break again. The link proudly brought to you by First Hawaiian Bank. You can check their website. The drive-thru is already opened. In-bank banking opens at 9. They go till 4. It's fhb.com. Also proudly brought to you by Calvo Enterprises and IT&E. It's the link on the Breeze 93.9. Good morning.
Summer is here.
I was superintendent of education for many years, and he was president of the University of Guam for a decade.
Together, we worked hard to extend opportunities from the youngest of our children to senior researchers at the University of Guam.
We understood that public service and the economy begins with education and returns to it time and time again.
But we're also partners in life, bringing together 8 children of diverse backgrounds, 14 grandchildren, and 1 great-grandchild.
I was born in Iloilo in the Philippines, and he was born in Tamuning, bringing together another combination of experiences which enrich our lives and our island home.
When we say Si Jules Maasi
and Maraming Salamat po,
it is because we have been saying it all of our lives, not just during a campaign. I'm Robert Underwood, and I approve this message.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
If you plan on leaving your house, don't forget your face mask. Along with hand washing and social distancing, wearing face masks can drastically reduce your risk of infection. Many people who catch COVID-19 can be contagious before they even start showing symptoms. The more people who use face masks, the less the virus can be transmitted and fewer individuals are exposed. When we both wear face masks, I protect you, you protect me, and we are both safe.
You live life on the go, and now so does your mortgage application with FHB Digital. It's easy and fast, with features that gather your documents or make it simple to upload them yourself. FHB Digital provides personalized mortgage options to suit your budget. And if you have questions, just ask a loan officer. FHB Digital. Bank at the speed of your life with First Hawaiian Bank.
When the world feels stuck at home, there are people who would love nothing more than to have a home. Disasters don't stop during a pandemic. Together, we continue to give help and hope to those in need. Help now at redcross.org.
We got your 6.
At 6 a.m. with the link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
A mask should not be a sign of weakness. A mask should not be a political statement. A mask should not be another way to divide us. A mask is a protective device, a barrier to protect you and those around you from a virus. A mask is just a mask. A mask saves.
Hello, my name is Onania Snively, and I'm here to explain the importance of wearing a mask. Mask in Turkish, polypollen awat arepotuj. Mask asisilan kichingaw. Mask asap asisilan and notes mail up for house. Mask asap ew alan I move fasanigit.
How do you just not go crazy and trash the room? And got to give it up to Rob there. I mean, obviously the guy has done his research.
Yeah.
And, you know, we just had people come in for a funeral. They got the exception and spread the COVID. Yet here's a guy who's trying to get tested. Can't. I mean, it's just.
There's no symptoms or anything.
Yeah. 8:47. We'll switch gears a little bit and bring on attorney Tom Fisher this morning on the link, the Breeze 93.9. Good morning, Tom.
Good morning, Chris. Good morning, Sabrina.
Good morning. Did you hear that story?
Yeah, we definitely want to get your take on this.
Yeah, I sure did hear that story. I want to hear KUAM's story.
Yeah, I think we all do.
What are they doing to help this guy?
Sounds
This
like
is an outrage.
checking his temperature. That's what they were doing.
Oh, well, okay.
Yeah.
That's a heartbreaking story.
Yeah.
Tom, why haven't we seen, a serious, I know there was one legal challenge with the district court with the roadblocks that was, I think Ken Leon Guerrero may have been filled out in crayon, but, why haven't we seen a serious legal challenge with this quarantine issue? Is this just something that you think will maybe come down later, or
Legally?
Or do you think that people do have standing to kind of?
Well, certainly anybody that's affected by a quarantine would have standing, but I think the question is whether or not a government is allowed to do this in a public health emergency. I think probably a short answer would be it's within the government's police power to do this. But, the fact that it's within the power doesn't mean that they also have the power to abuse those people who are in their care. And in my opinion, Mr. Shaw, a very articulate young man, is being abused. KUAM needs to deal with this, and they need to deal with it right now. There's a family out there that is before us all hurting, and they need to get on the stick.
Well, that's why I like you, Tom. You just never hesitate to give your 2 cents.
Right. And during this public health emergency, we've seen a lot of different things and a lot of special powers that apparently
but it's like they only have special powers when it's something to help themselves. I mean, where's the superpowers now?
Yeah. And what I saw in the newspaper, KUAM is receiving $1.6 billion in federal aid. They're awash in money. It's not like they don't have the resources to address this situation.
Right.
So address it.
Right. Yeah.
And if you don't want to address it, then we'll take care of that at the ballot box.
Well, there you go. Tom, go ahead.
No, go ahead.
No, you first.
No, I was going to say we brought you on to talk about the case that you filed regarding FOIAs and WhatsApps. And so if you could just kind of run us through what was the outcome from, I guess, the decision that came out?
From Judge Iriarte.
Yeah, Judge Iriarte published a decision last Friday, and what we were looking for is communication inside the Attorney General's office having to do with pay, and also communication between the Attorney General's office and the office of the governor having to do with pay. And, the AG weighed in and said, no, we're not going to give you anything. And the judge said, no, you are going to give him something. And what they are going to give so far is communications inside the Attorney General's office. As lawyers call them DNOs, decisions and orders. That came out last Friday and they still haven't complied. So
What's been has there been any communication, or are you just sitting around waiting for that email?
I am sitting around and waiting for them to produce the documents which the Superior Court has ordered them to produce. I will tell you, quite frankly, it has been like pulling teeth, not just in this case. This is, I was writing them down. It looks like just in the last 12 months, I've done 4 FOIA requests. Each of them has been opposed by the Attorney General's office. I've had to go to court and get a judge to order compliance each time. And as I've gone through this process, I was going to say it's ironic, but it's absurd, because this law is designed to allow people to read their government's communications unless there's a protection.
Right.
Yet, as we try to do that, they resist it each and every step of the way. Now, I've been in practice here on Guam for about 30 years, lawyer. I've been around the FOIA laws a little bit, and obviously the courthouse. What about a person who hasn't done that and isn't clear on how they would make a FOIA? And then when the agency just stiff arms them, 9 times out of 10, they're just going to drop it because they don't have, the wherewithal, the time, the institutional knowledge to proceed on their FOIA request. And frankly, I think a lot of the agencies count on that. You make something difficult and maybe they'll just go away.
Right.
This just in the last couple of months, I've had to go to court against the Port of Guam. Roy Respicio down there wasn't turning over procurement files. Obviously, just had to go against the Attorney General, and the Attorney General has been ordered to comply. GMHA, again, I'm going to be in court on the 28th. They haven't complied. And Guam Police Department last year didn't comply. It's mind-boggling. And, one thing about this DNO, which I think has, really moved the ball down the field, is it's now clear that WhatsApp communications, Instagram, Facebook, whatever, if you're conducting government business, you have to disclose that because those become public documents.
Wow, Tom, hold on. You hear that? You hear that? That's the sound of the cabinet and all the directors clearing their chats right now.
Well, the director and all the members of the cabinet who are clearing their chats right now are also committing a crime. Those are public documents. You can't just go in and destroy a public document.
Or can you?
Yeah.
In the DNO that came out on Friday, did it give a specific deadline for the AG's office to turn over these communications?
It did. It gave them 10 days. They're due on the 28th. And what I misunderstood. They have 10 days to turn over an index explaining to the judge why they are refusing to disclose certain documents. And they have to describe the document and why it falls within a privilege. There is no deadline. Well, there is. Immediately, they need to turn over the documents, the internal documents from the Attorney General's office. Those have to be turned over immediately. And here we are in business day 4, nothing.
Wow.
So would penalties apply? I think it's is it $1,000 a day for every day that?
Well, it's if we prevail, we expect to. The judge may order a fine against the agency head for $1,000. The fine goes to the guy. I want to make that clear. The money goes to the Treasury of Guam. It doesn't go to the attorneys, and it doesn't go to a plaintiff. It goes to the Treasury of Guam.
Yeah.
You've got to have teeth in these statutes. Otherwise, people will just blow them off.
They do. Yeah, they do.
Yeah, which they do.
Yeah. I think that instead of like a fine or something, do a fine, but they should also make like the AG or whoever doesn't want to give over any FOIA documents stand at Chief Kapua Loop with a big sign that says, "I promise I will be more transparent for the people of Guam."
Well,
I mean, that kind of like old school punishment, I think, because they don't care. They're going to pay $1,000 fine.
Well, you know,
Well,
go ahead.
The $1,000 is supposed to come out of their own pockets, of course, and for some people that's a huge bite. But these folks who are pulling down, 6 figures, I don't know how much of a bite that is on them. But if the judge can find that if it is unreasonable and arbitrary and capricious, that the individual has committed a misdemeanor. So theoretically, for example, Roy Respicio could be found guilty of committing a misdemeanor by not complying. The same with Levin Camacho. He hasn't complied, and the judge could take that extra step and find him to be a misdemeanor.
Tom, what do you think is the main takeaway for the general public here? Because it's, the FOIAs and, getting these documents. To me, it's really simple. It's like they're trying to hide stuff from you guys, and they're succeeding. And this lawsuit is about forcing our elected leaders and the people who work for us, who get paid on the public dime. It's about forcing them to comply and let us see documents, which there are WhatsApp community. Those are our documents. So to me, it's pretty simple what this is about.
Yeah, it's certainly not complicated. I certainly don't think any citizen needs to go running into court just to get the government to do what the government is supposed to do. There's a provision in the Sunshine Act. Here's a fun game to play when the government agencies open up again. They are supposed to post in a public area that is open to the public the procedures for making a FOIA request. And I would bet you dollars to donuts, nobody's ever seen one of those information posters posted in any government office.
Well, I like donuts.
When they open up, everybody should go have a look.
Right.
And I think, Chris and Sabrina, that making a FOIA request is not difficult. There's no magic to it at all. You just send them an email. This is what I want.
Yeah. I mean, there is a magic to it. And I'll tell you guys, I send a lot of FOIAs. And to me, it's almost disingenuous when you got to really specifically word the request the correct way, or they'll be like, oh yeah, I don't know, I don't got that. But they know the spirit of the request. They know the documents that you're looking for. And so,
that's usually their go-to.
Right. It's not just a problem for, Attorney Tom Fisher. It's a problem for the media. I mean, they will use exemptions that you're like, no, this is not a protected document. And then, what's the remedy? I mean, go take them to court. I mean, we're a small business, man. We got to, we're going to take them to court every time they drag their feet on a FOIA.
Yeah. And Chris, quite frankly, they know you won't do that because you don't have the financial resources to afford a lawyer to do it.
Right.
Et cetera and so forth. It just occurred to me, I wonder why maybe we should amend the charter for the Public Defenders Corporation to have them handle, regardless of income, have them handle FOIA requests.
Right.
Because, the people, it's our document. We get to look at it.
Yeah.
They ought not to be standing in the way of it.
Right.
Are you anticipating, though, that this is going to go to the Supreme Court?
I don't know. I don't know if Levin Camacho is going to appeal this decision of Judge Iriarte. He certainly has done what he can to prevent disclosures, but I don't know if he's going to take that next step.
Okay, Tom.
So, yeah.
Another thing that they do that I thought is interesting is I've FOIA'd documents that are already in electronic form, yet they'll print them and then try and charge you $5 million to get the documents that were already in a digital form that they could have simply emailed. But instead, they're trying to break your bank and be like, oh, you want it? Hey, we're going to print it out. Guess what? It's $500. So, guys, honest, the government, of course, they hardly ever give the information willingly.
And why is that? Why? It's mind-boggling. They consider it's almost like certain agencies consider their constituents to be pests.
Right.
Yeah.
All right.
Why are you bothering me?
Get out of here with your pesky FOIA requests.
Yeah. Get out of here.
Pesky meddling media.
Well, it's just a shame. It's just a shame, but you got to keep pushing. You have to keep pushing because one thing they're counting on is just exhaustion by the public.
Well, Tom, thank you. Thank you
Thanks,
for
Tom.
coming on. Keep us posted, Kay.
Yeah, I sure will.
And if you ever get those WhatsApp communications, why don't you WhatsApp them over to me?
Well, I think I will, and if I can, I appreciate you having me on, but my problems don't seem like much compared to Mr. Shaw. Yeah. And gosh, I hope GovGuam does something for him and they do it today.
Yeah.
Thank you, Tom.
Thanks, Tom. Take care.
Wash your hands. Be safe. Dig in the beard.
Yes, sir. Thank you.
You're gonna play Santa Claus this December, or?
It's looking more and more like it.
There you go, Tom Fisher. 9 o'clock, we're KUAM FM in Agotnia, Guam. It's the link on the breeze, 93.9. We will take a short break, and we're coming back with, at 9:30, we're getting public health. We have Dr. Suzanne Konashiro and Annette from the Contact Trace Division. They're going to be talking about community mass testing, the backlog of tests that have yet to be run by public health. So we'll go into all of that. And then also scheduled to get Rear Admiral John Manoni on the phone in just a few minutes. It's 9:02. It's the link on the breeze. Good morning.
I was superintendent of education for many years, and he was president of the University of Guam for a decade.
Together, we worked hard to extend opportunities from the youngest of our children to senior researchers at the University of Guam.
We understood that public service and the economy begins with education and returns to it time and time again.
But we're also partners in life, bringing together 8 children of diverse backgrounds, 14 grandchildren, and 1 great-grandchild.
I was born in Iloilo in the Philippines, and he was born in Tamuning, bringing together another combination of experiences which enrich our lives and our island home.
When we say, Si Jules Maasi,
and Maraming Salamat po,
it is because we have been saying it all of our lives, not just during a campaign. I'm Robert Underwood, and I approve this message.
We got your 6.
At 6 a.m. with the link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Half a day. I'm Dr. Jana Manglonia, Medical Director for Public Health. We all play a role in slowing the spread of COVID-19. We must continue to stay strong and practice everyday preventive actions to keep our island safe. Maintain a distance of 6 feet between yourself and others. Wear cloth face coverings in public settings. Wash your hands for at least 20 seconds. If soap and water are not readily available, use alcohol-based hand sanitizer that contains at least 60% alcohol. Clean and disinfect frequently used surfaces. Avoid touching your face. Stay home if you're sick. Let's protect ourselves, our loved ones, and our communities. Prevention saves lives. For more information, please call 311 or check out our website at dphss.guam.gov.
Half a day, everybody. Welcome back to The Breeze 93.9. It is 9:06 in the morning. Thanks for watching us on KUAM TV 11, streaming us on our Facebook page, or listening to us right here on The Breeze. We have got now on the line Rear Admiral John Manoni from Joint Region Marianas. Good morning, Mr. Manoni.
Good morning. How are you today?
Holding in there. How about you?
Good. Very busy. Lots of phone calls and outreach and planning, but it's good to talk to you. Thanks for having me on.
Oh, no, thanks for accepting the invitation. We hope to continue to have you on more frequently. And as you said, there's a lot going on your end. And if you could just, it's been a while since we've seen you in the Zoom press conferences at Adaloop. So if you could just bring us up to speed with what's happening in your neck of the woods.
Those press conferences were primarily focused around Theodore Roosevelt.
Right.
And I got to tell you, a little bit of hindsight now looking back on that, it looks like a big success for the people of Guam and the local military here, how the team pulled together and helped out sailors who were working through a tough time. And granted, that was at the beginning of this COVID crisis when we didn't have as strong an understanding as we do today. So in terms of, success for the community and success for the military, I'm pretty pleased and really happy at the way we all work together to help out our shipmates, and that was a big win. Through the summer, we saw that we were holding strong with respect to cases here on Guam and then the CNMI. Everybody, I think, was, hyper-focused on what was going on. And then of late, you can see with respect to COVID-19, maybe we collectively let our guard down a little bit, or maybe a little bit of COVID fatigue set in, or maybe, it just came in through a way, we weren't anticipating, because it is pretty amazing how flexible this virus is. Mm-hmm. And now we're having to respond both in the civilian community and in the military to a rising number of cases. Thankfully, we haven't seen a massive surge into the hospitals. And we're working through treatment. We've learned a lot with TR and through the spring and summer on how to treat better. But we're having to work through this process together. Mm-hmm. So that's kind of at job number one these days is this COVID response. But I think we're going to win this thing as long as we keep working together as a civilian military team. Mm-hmm. So I'll hold there if that helps. Right. Give you an update of what I'm dealing with.
You said lessons learned. What were some of the lessons that were learned from, I guess, the first wave and what happened with TR? And what are you applying and changed today in terms of the response the military is providing?
So I'll tell you, the big one, and it's almost, you can't argue against it, is that the preventative measures and the mitigation measures to protect yourself and your family and your shipmates work. So masks work is a simple one. Physical distancing work. And I'll give you a little bit of empirical data on that. TR had roughly 4,800 sailors on it that may or may not have been exposed. Of that, roughly 1,200 sailors at the very end, the final numbers were positive in some manner. Because a lot of those sailors and a lot of the leadership was confined to the ship or confined to quarters because they were either exposed, positive, or, we're working through that with them. Your team here, your military leadership had to step into that role in some manner. That involves, walking around to the different areas where we had people quarantined and isolated, making sure we talked with sailors and understood why, what their issues were, how we could make things better, seeing them face-to-face on a daily basis. That's the only way you can truly do leadership, is that management or leadership by walking around. Mm-hmm. To support the sailors out in the hotels and then on base, you had almost 1,000 people that were interfacing, that were military or military affiliated, interfacing with them on a daily basis, whether it be medical checks, dropping off food, taking out trash, changing out linens, transporting to and from, helping to deliver care packages. We did not have a single transmission or cross-contamination of COVID-19 between those 1,000 people that were working that process. I've been tested 4 times, and I was in those quarantine areas, face-to-face with those sailors. I wore my PPE, meaning my mask, my glasses if I was in close, washed my hands, physically distanced. I've been tested 4 times. I've been negative. So PPE, personal protective equipment, masks, and physical distancing work. If you don't do that, and because this virus has the ability to sit dormant or sit in somebody that is not symptomatic, they're not showing signs, but they may be contagious, if you don't put on your mask or don't physically distance, you could be the vector to transmit the virus from somebody through you to somebody who's more vulnerable. And that more vulnerable person could have a real tough time with the virus, even though you never showed symptoms of the virus. So again, PPE is not just to protect you from getting the virus, it's to protect the person, your neighbor sitting next to you. And so thankfully, even in my inner office here with my close staff, we haven't seen a transmission amongst ourselves because everybody wears the PPE and washes their hands and physically distances. That's a huge lesson learned for us, that those measures work.
Well, what about, what is the Navy's procedures when the Navy, as an employer, are notified of a possible COVID exposure and or positive results among their civilian, active duty, or reservist personnel? How do you guys handle that?
So you almost go into overdrive on that type of thing. So we pretty much mirror what GovGuam does also, in that if, say, my aide-de-camp who's sitting here listening to this is suspected of being COVID positive, so, influenza-like illness, has a sniffle or whatever, that's the first thing we do is we kick him out of the office and send him to the hospital to go get tested. Go figure out if you have this. And then we aggressively contact trace that individual, not only for his family and the health of his family, but anybody he works with. And if there's close contact, typically within 6 feet for a period of time or on a daily basis over time, we're going to quarantine those people or isolate those people. If we see any transmission, we're then going to, contact trace, say that I had some sort of then sniffle or bad throat or something like that, and we suspected me of having it, we would contact trace me. And then we're just going to start locking people down, because what we can't do is have this get inside our operational units that have to deploy, think ships, submarines, expeditionary units like the Seabees, because, at remote locations or on deployment, medical care or we don't have enough providers. You can't put a whole hospital on a ship. It spreads through ships really quickly. And then what we have to do is do the big 3 that Admiral Aquilino, who's Pacific Fleet, tasked us with, which is protect our people, don't be a vector of this virus into the civilian community, and preserve our mission. If we can't do our mission, why are we out here? Why are they paying my salary? So mission's got to come first, and to do that, we got to protect our people. So that's kind of what we do. It's very aggressive, and it's very hard. It's very resource intensive for both GovGuam and for the military here to pursue that course of action to make sure we can do mission and protect our people.
Right. As the number of positive cases have increased, and in the CIT report, it separates the increases in the civilian population and in the military population, and so we do see this increase in military service members testing positive for COVID-19. It doesn't break it down in terms of if it's Navy or if it's Air Force or if it's active duty National Guard. But one of the things that has been discussed is this hospitalization rates.
And for Naval Hospital, where are we with the hospitalization rate there and the bed capacity and resources that are needed to treat COVID patients?
So, as of my last official report, which was yesterday afternoon with respect to the U.S. Naval Hospital, there were no inpatients with respect to COVID-19. You know, obviously there's other things that they're dealing with there. But so bed capacity and ICU capacity is good, and we watch that very closely. We also watch the civilian bed capacity, ICU capacity, because I see that as a leading indicator. And then as part of this community, should the governor and the government ask, he may be tasked with responding to help, like we would in a typhoon or something like that. So we watch the local hospital capacity, both at GMH and GRMC. We watch our own capacity, which, again, right now I don't think I have anybody in the hospital, but I'll get a report later today on that. And then, as I've communicated before, you know, we have some additional capacity here that we held on island, that my boss is in Hawaii and I work through with the medical community to hold on island. Should GovGuam ask for help, and should we be tasked with it, we can rapidly build those things to provide services. And I think one of those things, you know, is that 10 hospital that was up at South Finnegan.
Yeah.
We moved that equipment down to the Santa Rita complex, the old middle school down there, sitting kind of in a standby break-in case of, you know, COVID glass type thing to be ready to set up if I get called to do that.
Right. I remember that. It was constructed over at, like you said, Finnegan's. And wasn't there a tent also over in Nimitz Hill area?
So it was up at a smaller system called the Expeditionary Medical System.
Right.
It's an Air Force system. That's in storage basically up at Anderson Air Force Base. And so normally, so you know, normally with the big tent hospital, the Navy one that was up at South Finn, that came off of a ship. And normally at the end of a crisis, you would pack that thing up and put it back on the ship, and the ship would go back out to sea or wherever it goes, and just sit there in storage. In order to prevent the timeline, the timeliness that you would incur of having to unload that ship again, bring the ship into port, unload the ship, transport all those containers all over the place, unpack those containers and build it. We worked, again, with leadership to hold those things on island. You know, I hate to say it, but we were worried about a fall resurgence of this virus. It looks like it came a little earlier than planned, so that we are postured to help if asked.
And speaking of asks, we had a Navy active duty service member. He flew in to Guam last week. His name's Rob Shaw. Did you want to speak?
Yeah, no, I think he's Air Force.
Oh, he's Air Force.
Well, I mean, maybe Admiral, we could just pretend if he was an active duty Navy guy who had come from, let's say, you know, New Mexico. What kind of jurisdiction would the Navy have over someone who comes here for a family funeral who may be on leave for that, and they get put in quarantine and they can't get out?
You know, that's a tough question, and I don't necessarily have the answer with respect to, you know, things that are classified as leave. So obviously, funeral travel would be classified as some sort of emergency leave, and so it is likely that they would fall, since that's not official travel, they would fall under Guam's quarantine and isolation rules. Because we're going to try and comply and align with the civilian community on that. So let me give you my experience. Here's a better one that I can talk to. So I recently finally got on some leave back to Cape Cod, Massachusetts, to see family. That was about a month and a half ago. Coming back on island, the military, even though I was on leave, the Navy dictated that I will go into 14 days of quarantine restriction of movement at a government-controlled facility when I came back on island. And so I complied with that. And thankfully for me, which was a little bit easier than maybe for some of these people, I was able to do that in military housing. But I was stuck in military housing for 14 days. And I was not coming out of it. The only time I was allowed basically out of my house was if I had to come do a secure video teleconference. Obviously, I don't have those systems in my house. So, and then it was back home and sit there with the dog for 14 days. So, you know, that was a unofficial travel that resulted in my restriction of movement because it was leave. If somebody comes in here for official travel, think a temporary duty assignment or a permanent change of station assignment, they're going to go into 14 days of restriction of movement / quarantine on the military. And we're going to do that, and there's no getting out of it, even if you have a test or not. So with respect to the funeral case, you know, I'm going to have to look into that, but I see that as unofficial travel and complying with government of Guam rules. But I'll find that out, and hopefully we'll be able to feed that back to you.
Thanks, Admiral. You know, we had a tip, and, you know, in the media when we get these tips, I mean, the best thing we could do is try and get them vetted by, you know, people who would know like you. The tip we had got was that the Navy had just got confirmation that one of their reservists tested positive for COVID after that person voluntarily advised command that public health contacted them through contact tracing for potential exposure. Instead of immediately taking that person off of duty, they allowed him to remain in a classroom with other reservists and sailors. They then sent him for testing at Naval Hospital this week where he tested positive. They are not taking steps to keep the local reservists safe, instead requiring them to come in to pull duty in the base and expose to a now known positive case.
Well, okay. You know, it is entirely possible that you know, our system is not infallible. However, we don't make decisions based on lack of data. So, you know, I got to tell you, watching the operations that Captain Grimes is running at Naval Base Guam and that the General Sloan is running at the Air Force and coordinating every day, it's a massive operation. And we've got hundreds of people that are either sitting in restriction of movement because of travel or because of close contacts or suspected close contacts that we're putting into some sort of quarantine or isolation. So any characterization that we're not worried about the, you know, health of individuals is just, that's not helpful and not accurate.
Just real quickly, I wanted to go back to Rob's story, the Air Force personnel. Does it matter, though, that he has orders from the Red Cross?
No, probably not. But again, I'm going to have to look into the legality.
Okay.
Right.
Because the Red Cross isn't a military organization, you know that, right? And that designation, typically in the death of a family member, that designation of emergency leave, and the Red Cross will say, hey, this is a local parentis, meaning this is a direct parent of this service member, allows commands to turn on things like funded travel and those types of things. But we're not going to, you know, we really can't take these risks even for funerals. And I know that's harsh, and I know that sounds inhumane, but we could be putting the community, the greater community, at risk to satisfy the desires of the individual. And unfortunately, I'm going through that very situation right now that I found out last night. So, you know, while I would love to travel for a funeral to pay respects to somebody very close for me, I can't do that.
I think, Admiral, and then I know that you maybe weren't listening because you had that meeting, but in the specifics of this case, what I think is really rubbing this gentleman the wrong way is that he's asking to be tested so he can get tested out, and they just won't give it to him or whatever. But, Admiral, I wanted to go back to the ask here. So you had said that in the event we need additional, medical facilities, whether they be the tents or what have you, that those will be triggered when the governor makes an ask. So are we talking like in writing? And then can you maybe walk us through the turnaround from when you get that official request to when we're going to see these facilities or, the equipment ready for use?
So that's a great question, and it's actually something that a lot of people don't understand, including me. So, when I first got here. So, the lead federal agency for disaster response is not DOD. It's typically FEMA. And so, again, think to a typhoon. What people try to do is they try to posture to themselves so they can respond quickly should an ask and then a mission assignment come. And that's across all government agencies. So what would happen would be the governor would say, hey, FEMA, or somebody in the government would say, hey, FEMA, we need some help. FEMA doesn't look at DOD as the primary resource to fill that requirement. Mm-hmm. It's going to look everywhere but DOD first. And that happens fairly quickly. They're constantly updating who could provide resources and who couldn't. And so, FEMA could task a local civilian agency that has resources. It could contract locally to provide those resources. In the event that there's nobody that can fill that gap, that need or that requirement, it may look to DOD and say, DOD, we need you to look at this. DOD would then have to validate that requirement as we call it a valid mission assignment. So FEMA would say, hey, we assign this to you, DOD, and DOD would say, yes, that is valid, and we have the ability to source that requirement. DOD, through the chain of command, and again, these things can happen fairly quickly with phone calls, and then you back it up with emails and formal tasking letters. DOD would then say, okay, who's in the area? And it would normally come through Hawaii, and then Hawaii would task it to us and task it to other units because, again, I don't hold, like a pool of medics or doctors on island that could source this. So they would say, DOD, have at it, and we would build that hospital down there, and they would fly in medical providers. So there is a time penalty for all of that, being that we're on an island in the Western Pacific. But DOD, my boss is back in Hawaii and elsewhere, and locally, is working to, again, shorten that timeline to as tightly as possible so when the call happens, we can build the hospital quickly and get people on planes to provide service as fast as we can.
Sounds like somebody in Admiral better start writing a letter.
Well,
because it's wow.
You got to look at it from the perspective of, if we can get this thing to plateau, if people do the right thing, then we don't need to make that call because you also got to understand that local governments, there is a copay with FEMA. FEMA's going to ask for resources from local governments wherever they're at, states, territories, to help fund these deployments of personnel, whether it's a locally contracted solution or Department of Defense. So there'll be some sort of copay. So it's something you have to think through. What's the best use of your resources, and is this the right time to make that phone call?
Mm-hmm. Admiral Manoni, by any chance, would you have any information on the start of DODEA schools and whether or not it's going to be face-to-face or remote learning?
So we've requested remote learning to start 2 weeks. Now, this was not a decision that I came to easily because as the husband of a teacher, I know that in-classroom instruction is the best way to go for most. Mm-hmm. But with the rise in cases that we saw starting roughly around August 9th that we were watching very closely, the governor's declaration of PCOR 1, their decision to go to a remote learning environment, I think it's prudent that we request that. I have a conversation with the DODEA Pacific director today on that, but I don't see it as an issue that we would start with remote learning. The way I'm characterizing it to military constituents is this is a soft opening. You know, we have to step through the opening of these services deliberately and methodically, and I think going remote learning is a good way to start the learning process with the ability to transition to a brick and mortar learning, in classroom learning at a later date, and we're sure we've got this thing licked.
Sorry, I never heard that brick and mortar learning.
Sorry, I'm old.
I know, I get it. I'm old too. Don't worry.
Me too.
Google it, kids. Brick and mortar. It means you in a building. Bree?
Was there anything else that you wanted to ask him? Is there anything else you'd like to pass along to everybody? Your final message, Admiral Manoni?
Yeah, so this one kind of goes out to, thank you for that. This goes out to kind of the beneficiaries of the bases. You know, there's a lot of angst and nervousness that we're going to have to close off services at all the different installations on island. And the intent today is to kind of hold what we got. You know, we may have to elevate our health protection condition to a higher level. That would likely be at an administrative elevation to align all the different things we're trying to do within defense lines to prevent the spread of this virus. If and when I do that and make that decision, there'll be also a deliberate decision to control access to the bases. And this has never been somebody's valued more than somebody else, or one group's more important than one other. It's about mission for me. You know, I have to preserve mission at the airfield, port, and telecom station. So I may have to segregate groups again or control access. But that will be a deliberate decision that's communicated appropriately. It's not going to be a snap decision that we do overnight and surprise everybody. So just pay attention to the Facebook pages, listen to the radio, look at the JIC releases and the JRM releases on that so you're informed. But everybody needs to know it's coming from a position of protecting mission and looking after our people, and that's it.
When you talk about the HP con, are you saying that we could revert back to what it was when we saw the first surge, or so even stricter?
Health protection condition Charlie.
Yeah.
So that pretty much aligns with PCOR 1. They don't line up exactly right. We're in what's called Bravo Plus, which means Bravo but more restrictive measures. We've tightened things down internally on the bases more because we're seeing, inter-unit spread of this virus that looks like it was transmitted from off-base to on-base, or came from off-base to on-base, maybe through service members, maybe through civilians, who knows. So this HP con elevation would basically align everybody's efforts under the same thing. You know, there is a level higher than HP con Charlie that I'm very reluctant to go to.
Is that level Delta?
That's Delta. I don't see us going to that as long as we can continue to control this virus. The hospitals don't get overwhelmed. We don't see mass morbidity. You know, as long as we're working through this together, I think we stay where we're at.
Admiral, there was just one more thing. In the first lockdown, we saw this whole thing where we had the veterans and retirees, and there was a situation with access to the commissary and lines, and so as we are now locally outside the fence line and back in PCOR 1, has the Navy, have you guys kind of retooled what was happening before? Is it still happening, or are people still, going through that on the Saturday?
So the naval base currently is open every day for all beneficiaries, but the limiting factor on the naval base with the commissary and exchange is the 6-foot distance. If you map that out in the commissary, you can get roughly 70 people in there at any one time. If you look at it like a smaller NEX, like up at Naval Hospital, it might only be 5 to 10 people at any one time. So if you think about this as water flow through a pipe, unless you make the pipe bigger, you can only get a certain volume through it. So the naval base is holding fast on that, and it's been the same way since probably April, May time frame. I think it was May when we went to all days were open, but we still have to limit access by numbers.
Okay.
The Air Force Base is open to veterans, retirees, and others on the weekends. And the reason there's a little bit of misalignment there is they're different bases with different missions with different layouts. The Air Force Base Commissary Exchange Complex is right across the street from its most important command and control nodes with respect to airfield operations. The Naval Base Commissary Exchange Complex is roughly 3/4 to a mile away from port operations, the wharves and piers. So, you know, I'm okay with a little bit of misalignment there to preserve those missions.
Right. Okay.
If you do go into HealthCon Charlie, though, are you going to be restricting, I guess,
Access, or maybe changing up who can go when?
Right.
So no, so it's not a binary decision. It's not an if-then. If Charlie, then we restrict access. If and when I go to Charlie, then we will start working through the process based on the conditions of spread if we need to restrict access further to the bases. So we're not necessarily seeing today that the NEXs and commissaries are the mixing point or the point where we're seeing spread of this virus.
Right on.
So it'll be a deliberate decision. It won't be a, you know, if I do this, then I'm immediately going to snap to restricting access.
Cool.
We'll have to work through that. And I've been keeping the veterans and retiree groups informed of that as we go through that. They seem to be okay in the majority that we're communicating appropriately at this point.
Admiral, we really thank you for this opportunity. We got to
Thank you,
run because we
Admiral.
got public health standing by, but we want to make this a regular thing, and I think that, you know, people want to hear from you, you know, so if we could, maybe weekly or however we can arrange to just have you on the show and check in, you know, as part of that civilian-military partnership that we hear so much
I'll have
about.
the PAO here, Lieutenant Commander Rick Moore,
Okay.
who set up a more regular drumbeat. We'll
Right.
figure out what works for both of us.
Okay, thanks,
Thanks
Admiral.
a lot.
Thanks, guys. Have a
Wash
great
your
day.
hands.
Yeah, be safe.
Okay, see you. Right on. Let's just go right over to the KUAM News Zoom room on the link. It's The Breeze 93.9. As promised, public health. And we have Dr. Suzanne Conashiro and one of our faves, Annette Uggan. What's up, girl?
Hey.
Half a day.
Half a day.
When
Well,
I
thank-
messaged her this morning, I said, "Good morning, sunshine." You going
Yeah,
on?
so thanks for joining us. Dr. K, welcome to the show. Don't worry, since you're with Annette, we have to go easy on you because she's already family. She's been on here a bunch. I guess, ladies, we'll just get right into it. Very concerning news about this backlog of tests, swabs that were run over the weekend. My message box on all the social media and the phone, people are saying, "Hey, I got swabbed. I wanted to know. I know someone who had it, and we're still waiting for the results." So, if you could tell us just right off the bat, how many tests are we backed up with public health, and what's the plan to get those tests run? And when we finally do run those tests, how can we hold the results with any validity if it's a snapshot in time from, a week or more ago? So go ahead. Ooh, Annette, can we hear? Oh, there you go.
Specimens,
Sorry,
and again,
Annette. Go
this
ahead. Start over. We had a problem there. Go ahead.
Oh, yes. So we have over 1,500 specimens, and that is including the specimens that we have received throughout this week. So we receive specimens. Our lab is running tests, and so it's kind of we run tests, then we receive more specimens because the demand is high. However, these specimens are being stored properly, and they are still viable and will be properly processed in order to get conclusive results. So we just want to reassure the public that these the swabs that were received over the past few days are being stored properly, and that they are still viable when they are going to be tested. We do understand people's concerns about waiting longer than normal. The public has been turning around results normally 24 to 48, maybe 72 hours in the past. And that actually was, we had that turnaround. In the mainland, people were seeing 3, 5, 7 days. And so now with this overwhelming turnout that we had on Saturday, yes, it's increased our turnaround time. However, public health is working on testing every single day. And so we actually received a shipment last week of test kits, and we burned through that quickly. And that comes from CDC. And so again, we're receiving a shipment today, so that will increase our ability to test more on a daily basis. Our staff is working diligently, longer hours every day to catch up on this backlog. And we have our partners who work. We are also using other testing platform like at Northern Public Health, the Northern Region Community Health Center. They are all Abbott ID, and so we're expanding our testing platforms and strategies so that we can catch up on this backlog and give people the results in a timely manner.
You said 1,500 samples?
And this is coming from all providers, be it public, private, and the hospital, sir.
Right. So let me just Dr. K, good morning.
What is the shelf
Good
life for these
morning.
samples? Like, how long can you hold them before they
Rotten.
yeah.
Or they're not usable anymore.
So 72 hours in refrigerated, and then you freeze them, and then they can stay there longer for as long as they need until we test them.
So as long as you freeze them, we can test them next year?
Oh, no, that will be tested in the next few days.
No, I'm asking what's the shelf life? Like, how long is that going to be good? You said 72 hours refrigerated. Then if you freeze them,
Refrigerated.
right? So how much longer after they're frozen are they still going to be good to be ran through the machines?
They can last for several months, but again, our goal is not to wait that long.
Yeah.
As soon as we're getting our specimens, we are trying to test them as quickly as possible.
So Dr. K, the specimens now are in the freezer?
Correct. It's in the lab. It's in the freezer in the lab.
Okay, that's got to be a pretty big freezer. Is it like a walk-in?
We have several.
Okay.
We have several freezers.
Okay. So let me just ask the obvious question here, right? And this just goes back to the snapshot in time comment that we had from Dr. Michael who is on the Governor's Physicians Advisory Group. And we had people go get tested over the weekend. And, so maybe we'll start there. How many tests do we have left over from the community mass testing that took place on Saturday at, was it GIGO? And
Yeah,
then also
GIGO and
SDA and AMC. So how many of those tests are left from the weekend?
Yeah, we are. Hello?
Yeah.
Hello?
Yeah, we're here.
Sorry, there's like a interference or something.
Yeah.
So we are, how do I say this? We are prioritizing specimens as we receive them. And so we do have a mix of specimens that come in for priority testing, like at the hospital, or a symptomatic individual or someone who needs pre-surgery clearance. And so our lab staff is balancing testing the ones from the community testing as well as those that were received and requested for stat testing. And so right now, we have a mix of those specimens from different providers that our staff is pulling from to test and prioritizing as needed throughout the week.
And maybe I missed this. Are these samples only the backlog only from this past weekend, or are we talking like 2 weeks ago or a month ago?
No, just because of the overwhelming turnout from this past weekend.
Just from this weekend.
Right.
Okay.
Okay, so now let me go back to if you went and got swabbed this weekend and then you went about your, business. Let's say you're one of these knuckleheads who doesn't know how to stay home, and you're out there licking people's faces, touching doorknobs and just getting COVID, basically. Then you get your result from when you were tested over a week ago, and it's negative. I mean, is it even really worth running these tests anymore?
Again, the testing, just to clarify, the day you were tested will only explain past exposure.
Right.
So if you got tested and then went out and about that same day up until now, yes, you could have been exposed again. So one negative test doesn't mean you're negative, for the rest of the time frame of this outbreak. There is the need to be tested. And going back to what you said about going out and about, and that's something that we have to keep emphasizing is, and we keep hearing it, unfortunately, is people who are symptomatic are going out and about. They're still going to work. And so again, we urge the public to please stay home if you're feeling sick. And so that's where we're encountering some cases where, oh yeah, I was symptomatic, but I still went to work for so many days, or I went to a party and stuff. And so it makes it that much harder for us as a community to contain this virus, because again, we can't do it alone. We need the public's help to comply with the social distancing measures and the common sense of staying home if you're sick. Stay home if you know you were exposed to a confirmed case. You need to quarantine for those 14 days, unfortunately, because even though you're tested maybe on day 7, your symptoms can appear later on. It's different for individuals on when their symptoms start. Your immune system is different per individual. And so again, it takes a coordinated community-wide effort to help us in that, so the one test result is only a small picture in this whole response effort.
Right. So again, I mean, are we going to do anything to maybe retest people who were swabbed last weekend? Because like you said, and I think we can both agree on that, it's a snapshot in time, but the problem is that time passed already. So what I had heard is that and that was that some of the doctors were really pushing for public health to get a hold of people and say, hey, should we redo this? We canceled the mass testing this weekend. So maybe if you could address again, like we get these results a week out from when they were taken, is it even worth anything?
Okay, so how do I exit here?
Yeah, I think you have someone must have the show up on a tab. Yeah, so I think you got our Facebook open, which we appreciate. I like that. You could leave it open. Okay.
Yes, sir.
So that's what that is. Go ahead.
There was another iPhone being connected.
Oh, no.
Sorry, can you repeat your question?
Again, so if it's a snapshot in time and we're going to get these results, for a week and a half, and we don't know what the people who were swabbed were doing, we're supposed to be in a lockdown, yes, but, like you just said, people aren't complying. So is it even worth it to run these tests? And when we talk about snapshot in time, how accurate is it going to be when we look at the surge and we add these questionable numbers into the mix?
Mm-hmm. It helps with the picture, sir, in that at least from that time you were tested, and if you felt you were exposed prior to being tested and you came out negative, then at least for exposure, you were negative. Moving forward, should you feel that you were exposed, or if you were contacted that you were identified as a close contact, then yes, you should get tested again. However, our refocusing of our strategy is to really hone in on those that are deemed high risk, because again, this community testing where it was open to anyone and everyone is straining our resources, unfortunately. And so the department has gone back and said, let's refocus our testing efforts to those that really need it, those who are identified as close contacts, those who are high risk, be it because they're frontline healthcare workers and the law enforcement, the EMTs,
testing criteria,
as well as the congregate settings, the elderly, and those who need surgery but need to be cleared before they go in, and those trying to clear out from travel, the quarantine, like Dr. K mentioned. And so those are the ones that we really need to focus on, because as we've seen in the mainland, we have other jurisdictions also reporting that they're burning through their testing resources for community testing, and they've had to refocus their strategy on the high risk groups because, again, it's a lot of strain on our resources, be it human as well as the test kits. And so we want to make sure that moving forward that we focus in where the highest risk is, and that we're expanding our capacity with our private healthcare partners as well, and the public community health center in the north that offers more testing opportunities for individuals. But to continue on at community testing without symptoms, it will continue to strain the system.
Right.
So that's why we need to go back to prioritize and have our strategy indicate high priority first.
Rapidly evolving.
Which, I mentioned earlier with the
And it just sounds like when I look at the triggers for moving out of this PCOR 1, and albeit the deadline, we're in this till next week, Friday or Saturday, it just seems like we might be in PCOR 1 a lot longer.
Unless they don't run the test.
Especially if testing is one of the triggers to move forward, the capacity to test and contact tracing and hospitalizations.
And yes, that's why by streamlining and focusing on the high risk, it will give us a better picture, because then we know for sure, oh yes, these identified close contacts have been tested, but you know what? The majority of them are negative. Okay, we have a few positive, but are they household contacts? Was it community transmission? Because then we expect household contacts to become, a majority of the new positives coming from household contacts. It's to be expected because they're in the same household as a known case.
Right.
So helping us focus our testing on those who are at highest risk will help guide our department as well as the physicians advisory group and the governor on next steps. And like you said, Bree, whether should we extend or can we stop in 2 weeks? But having this casual testing, as another jurisdiction called it, makes it more complicated because yes, we're having these overwhelming numbers of worry wells getting tested, but we also really need to make sure we're focusing on the high priority groups, because that will definitely paint the picture is, are we containing the virus because it's only at the house or for household members, or is it only at quarantine for people who came from non-low risk areas where there is widespread transmission in their respective jurisdictions that they came from.
Dr. K, how are we going to tackle these 1,500 tests that are in the freezer? Are we looking at enlisting other places like the hospital, or does the guard have the capability? Places that have the capability. So if we're backed up 1,500 tests.
So we do have.
Go ahead.
So we do have. So we still continue testing at the Guam Public Health Lab. So we have a ABI machine that we're using. Also, we have the Abbott machines we're using at. We can't use that one. So we also
why can't
have,
you use that one? You said you can't use that one?
The Abbott is not used for specimens that were done already. So the Abbott is actually done for new testing, right?
Okay.
So like, for example, if we're testing at the Northern Community Health Center, we would be using the Abbotts. So those are for current testing.
So you can't
right?
put a frozen sample in the Abbott.
Correct.
Right, okay.
Correct. So for the previous samples, we would use our ABI machines. We also expect our Gene Expert test kits to come today or tomorrow, so we're going to use those. We also have a contract with DLS to also test our specimen. And we also have another lab we can use to test our specimen, so we can get rid of all the backlog of our specimens.
How long is it going to take to get rid of the backlog?
So it's probably another, I say about another maybe 7 days, maybe.
Wow.
Just to get through.
I got a
because not only are we testing that, we're also testing new ones as it comes
Right.
in, right?
Mm-hmm.
So I would maybe 7 days.
So
just to
what's
be
the-
realistic, 7 days.
So what's the plan? Is it like, let's run 200 from the 1,500 backlog and then whatever else we're getting new? Is that how we're going to chip away at this 1,500 test backlog?
So we would prioritize what's new. So for example, if we get something from GMH, for example, and they're a priority, we would run those, right? The ones that were done previously first, right? So the oldest ones first, right? So that's what we would plan to do.
Okay. And then
What happens though within these next 7 days? We continue to see a surge in cases, and more tests have to be conducted. I mean, we could keep going on and on with this
circles,
backlog.
Yeah.
Yeah. So if we have new cases, that's why we focus on the identified close contacts. The number of people that we need to coordinate for testing will be a little bit more controlled. Also, we also recommend in the testing, just because someone was exposed, normally it should be 5 to 7 days from your known exposure to be tested, because if an individual is tested too soon, you may get a false negative. Right. And again, the body, a person's response to an exposure, the body takes about 5 to 7 days. And so that's usually the window we're trying to get people scheduled to test. So just because if we get an unfortunate surge in cases again, we're looking 5 to 7 days from now. And so we will keep chipping away, as Chris said, from our backlog. And again, with the shipment of gene expert test kits coming in, that will definitely boost up our capacity. We have the assistance from DLS and the other lab provider to help us. We also have the support through CDC and the Pacific Islander Health Officers Association, PAHOA, where they've actually contracted another lab staff to assist us. And we've also asked, which is going to help our staff who are running, every day to clear out that backlog, as you mentioned.
How many frozen samples can public health run per day?
We normally would do between 250 to about 350 with the different testing platforms that we have available. Normally in like an 8-hour shift, you're looking at approximately 207 specimens, and that's on the ABI as well as our gene expert. But our staff are pulling 12, 14 hours or longer. And so that's why we can increase to over 300 tests a day. And that's just Guam Public Health Lab. And then we have the DLS helping us. And as Dr. Kaneshiro mentioned, Northern Community Health Center is using the Abbott, which is the point of care testing. So now those specimens are no longer coming to Public Health Lab because it's being tested on site.
Right.
When's the last time you guys have experienced this sort of a backlog?
Never.
The first time. Okay.
As I mentioned earlier, our lab was turning out 24 to 48 hours during this outbreak, which again, even people were amazed how quickly our turnaround time was, because we were towards the top in the nation with that short turnaround time.
Dr. K, let's say I got swabbed at GIGO on Saturday. I'm waiting for my results. When public health calls me, what is the conversation like? What do you guys say to these people who are waiting?
Well, we tell them, it's because we had a delay in our testing of the specimens. So that is why we're just telling you now the results. And it's because the turnout was so great that, the interest was so great on Saturday that it actually caused a backlog in our lab. So now we're trying to test as we can, and then we tell them the result as soon as we could do it.
And then what do they say? Okay, no problem, or are they upset?
I don't. Maybe some are questioning. Like, for example, some are questioning, how come somebody was tested yesterday and they got the results today, compared to I was swabbed on Saturday and I didn't get my results. So we actually have to explain to them it's because of the way we tested with the Abbott machines, right? So you tested on the Abbott machines, you would get that result within 24 hours compared to those who were swabbed on Saturday, because it's a different machine, right? So we just have to explain to them why some people got the results first, because it was the way it was tested.
Right, and we see that where the senators, right, there was an exposure at the legislature, and then boom, the senators all got tested. And I thought I saw a comment where it was like, wow, they got their results so fast. So if you come into contact with a known positive and then you are contacted by public health as part of the contact trace investigation, the test that you will get will be the rapid test, right?
If you're scheduled to go up to Northern Community Health Center. We
Right
do have
now,
some contacts who are.
We are.
Sorry, Doc.
Go ahead, Doc.
Okay, so right now, if you need to be tested, we try and schedule you at the Northern Community Health Center, so you can be using the Abbott.
We had a comment here from Natasha. So do we wait to go back to work because of the backlog?
It depends on the individual. Are they identified as a close contact, then they should quarantine for the full 14 days from the last known exposure.
Sorry.
Yeah. Dr. K, are you there?
Yeah, sorry, I couldn't hear you.
Can I ask about
What was the question?
Actually, we're going to move on. I wanted to ask about a situation with a woman in quarantine and what the protocols are in terms of testing. Are babies supposed to get tested or required to get tested?
So for in this case, since they weren't quarantined, right? Actually the doctor at the quarantine site or isolation site recommended that the baby be tested as well as the mother. So even though the mother was negative, we actually had to test the baby as well, just to make sure that the baby was negative. So that's what it was recommended by the doctor, that the baby be tested as well.
The doctor at the quarantine site? So we have doctors at quarantine sites now?
We have a doctor on call at the quarantine site, yes. Also, we also have a doctor on call at the isolation site.
Mm-hmm. So in a matter of 5 minutes, so you're talking about Christina Leon Guerrero's case, you're familiar with it?
Correct.
Okay.
Correct.
So when the QFAC told her you were good to go, and then called 5 minutes later, no, your baby needs to be tested?
No, they told her that even though she was negative, her baby also had to be tested because she came in with a negative test.
Right.
Right. And so the baby had to also have been tested, and the baby wasn't. Okay. So we recommended that the baby also be tested.
Right. And
just to make sure.
Yeah, she was just saying that it wasn't in the public health memos because she had read everything before she had arrived to Guam.
Yeah. And Dr. also seemed to
yeah, he was
kind of question that. Yeah.
So does that say that in the guidelines and in the memos that babies need to be tested when they're, I guess, traveling and they arrive to Guam? That is mandatory? Because I saw there was like a 5-year-old and above.
So it also did say that if the physician advises it, that they should be tested as well.
Right. Well, let me ask you about the other quarantine nightmare that we had this morning. Guy Rob that came in to Guam with his negative test. He's here to bury his little brother on Saturday. He's the oldest son in the family. Unfortunately, he had the bad luck to get on a plane from Hawaii with somebody who was positive. I know you guys know this whole plane thrown into quarantine. So Rob is asking to be tested so that he can go to his little brother's funeral. And he says public health advised him to either A, get the family to move the funeral, or B, attend the funeral via Zoom, which is totally insensitive, totally lacking in compassion. So what is the protocol? And this is a unique situation that these people came in on this plane. But he's saying if he's designated as a person who is high risk of exposure, then give him the test. So what options are available? Because it's so inconsistent. We just a couple weeks ago had people come in for a funeral, they got the waiver, and then they spread the COVID. So what is the protocol for a gentleman like Mr. Rob?
Okay, so for this particular...
Go ahead, Doc.
So this particular instance, because they had a positive on the airplane, the protocol was if you were in close contact with that positive case, you would be quarantined for the full 14 days. If you were not in close contact with that positive, as they investigate, depending on where you were seated, you'd be quarantined for 7 days. So depending on where you were situated on that airplane and where the positive case was, it would be either 7 days for non-close contact and 14 if you were close contact.
And there's no option to test out?
Right, no. The medical director does not advise that if you are in close contact, you would be in there for full 14 days. That is under the advice of Dr. Manoni. And she is following CDC guidelines.
So there's just no remedy for someone like Rob?
Unfortunately, no, sir.
How does that make you guys feel to know that this guy is coming here to bury his little brother? And it's unfortunate. I understand that you have the protocols and we're keeping the public safe, but when we hear it's okay for some people and not for others, I mean, and then I know this has got to weigh on you guys. And knowing this guy was just on the show, I mean, he's well informed, he's articulate. His family is just torn apart because he can't be there for his mother. He can't be there to say goodbye to his brother. Does that weigh on you guys?
It weighs on me. I mean,
yes, definitely.
But it's it's COVID, right? And so we just want to protect everybody else from getting COVID. I know that this one particular person, came here to bury their relative, but we need to protect, the community. That is COVID today. I mean, if that was me, I would feel so bad, right? But in the interest of the community, we need to protect them from COVID.
Yes, and if I can just remind Chris and Bree, just a few weeks ago, we're dealing with the repercussions of funerals, and that's where cases have a link. And so that's what we're trying to avoid again is a further spike in cases and this is why we went into PCOR 1 and the governor had to make those changes in regards to funerals and rosaries, because she herself had witnessed, and she said it on the media, she's been to funerals and rosaries where not everyone was wearing their mask or practicing social distancing. So yes, my heart goes out to this family. Again, we are compassionate. We're humans. We feel the pain, and we are apologetic about the situation. But again, yes, we are having to look at the whole community of Guam, the health of the entire island of Guam. And so our concern again is to follow those protocols per the medical director. And again, it's not that we're trying to give this individual a hard time and not have compassion, but again, our first priority is the safety of the whole island. And based on our recent experience with funerals, and we've seen numerous cases as a result of those funerals, we have to take this unpopular but necessary stance.
Right, but then we have other cases where you hear about the lieutenant governor and the governor getting tested, multiple times, and this guy can't even get one test. So you see how people look at it, Annette, right?
The protocol is that because of his high risk exposure, where he was situated on the plane, even if he's tested, he still will not be able to get out per the recommendation of our director because of the time frame of the flight and being exposed. And so that's why the 7-day test out doesn't apply to him, because he was exposed on the plane and would need to quarantine. And so he did have a hardship exemption prior to getting on that plane, but during the plane ride over, that's where he had another high risk exposure due to his location on the plane. So that hardship exemption is kind of mute because now of his new known exposure on the plane ride over.
So basically, if I sat 4 seats away from the positive person on this plane, then I could go out. I could be released from quarantine. I could test out.
You could test out if you met. you could test out if you met the other requirements on the current quarantine protocol for inbound passengers.
Wow.
But if you're within the 3 rows of the case, then unfortunately, that's where the new set of restrictions come into play, as Dr. Kaneshiro mentioned earlier.
And then
Per
those
our
all these
medical
new
director, Dr.
restrictions are all in writing and have been produced to Mr. Shaw? Or it's just a
These
phone
protocol-
call? Yeah.
Yes.
He has them all in writing, and we can look this up on Public Health's website.
We do have it. Yes.
So it really boils down to, well, you sat in the wrong seat.
Yeah.
That's what it sounds
So,
like.
like, if Rob was on the edge of and the person next to him is probably out walking around. That's crazy. Yeah.
Yeah, it's unfortunate where he sat.
Well, that's one way to put it.
And there's absolutely nothing that can be done at all.
No.
Besides move the
As per
funeral.
medical director. As per medical director, 14 days.
Okay. Thank you. We got nothing, but I'd appreciate the director getting you guys on. I really appreciate it because, we need that public health presence during this public health emergency. So thank you for standing in and answering the questions. That's the best you can do, right?
Yeah.
And the best we could do is ask them. So
And I guess, and we understand that you guys are overwhelmed
Yeah.
with everything that you're doing. So we really appreciate you taking the time to come on. And maybe if there's anything that you would like to say to the community.
We would just like them to, under PCOR 1, we just stay home, follow social distancing, wear the mask, hand wash often. We need to stop the spread of this COVID, right? We're still seeing cases of positives every single day. We just want to make sure that it doesn't spread anymore. So please stay home and follow the guidelines so you don't spread the COVID anymore.
Annette, as the lead of the contact tracing team there at Public Health, your closing statement?
I echo what my chief, Dr. Kaneshiro, has mentioned, and again, to really emphasize, if you're sick, please stay home. Even if you think it's just a cough or a cold, please stay home, because that's how we can help contain the spread. And again, it's help us to help you. It's a community-wide effort. And yes, it's washing your hands, wearing your mask, and the social distancing, but please to comply with the measures that are put out there in the guidelines so that we can help stop the spread and reverse this the course of the new cases, and so we can slowly transition back out of PCOR 1 and to open up our island again.
Well, thank you.
Thank you.
Thank you, Dr. K. Thank you, Annette.
Thank you.
Okay, we'll
Take
see
care.
you. Wash your hands. Stay home. Well, okay, that's the.
All right.
Jake?
Oh yeah, can I get it? Can
Yeah,
I
you
just
can.
jump in? I just
Yeah,
wanted
please.
to just wanted to add that right after we had our interview with Rob earlier. If you guys have seen him on Facebook, because again, his story, very, very touching, obviously very heartbreaking. We did reach out to him. We called the mayor of Mauricio, because a lot of you on Facebook were good enough to say, where's the mayor and all this. I called Mayor Ernest Chargaloff. He actually told me he is incredibly familiar with Rob's family, because if you guys see him on Facebook, Rob is from Familia in Barcinas. And if you guys know anything about the great village of Malesso, there is a huge family presence from the Barcinas. Sabrina, you're related to at least like 2 or 3 members of that family. I know they throw the best fiestas ever in the South. That part.
Yeah, they make the best empanada and they got the best kite.
Yeah, and Mayor Chargaloff, longtime mayor in Malesso, was actually saying that he knows that family. His heart goes out to them because apparently Rob's family's property, like right after Hemlani Apartments, right after the bridge, on the right side of it, that's all Barcinas family.
Yeah, flooded.
Apparently, Mayor Ernest's family way back used to own that property. So he knows the family. I believe he said he grew up with Rob's mother. They were children together. They went to school together. So he said he's going to reach out to him and they're going to see if they can do something for the family. So again, if you guys know Rob, if you guys just feel compelled to help Rob and everything, we encourage you to go on our comment stream. Please message him, send a message of sympathy, of hope, of inspiration. People have put all sorts of things and everything, and we thank you for doing so. But reach out, because he is a member of our family, being from Guam, and they really need your help right now. So, do what you can.
Right on.
All right, thanks.
And the mayor said he will reach out, so he is.
Right. I thought it was Sabrina's turn to pray today, but.
Oh, we're praying?
Yeah, well, I prayed yesterday. Jason prayed the day before. But if you want to save it for tomorrow and go into the weekend,
sir.
we could, yeah. Or it's up to you.
Sir.
No, I think we could save it for tomorrow.
Okay,
Yeah.
there you go. 10:16. That's because Bree's
We're
going to
way
angry
over.
pray. Yeah, she's going to angry
way over.
praise right now. Yeah, we are. Thank you. 17 minutes of overtime. I definitely could use that on my paycheck. Hey, it's been the link on the Breeze 93.9. Proudly brought to you by First Hawaiian Bank, Calvo Enterprises, and IT&E. Can't thank you guys enough for all the support. We're here for this. If you've got issues with quarantine, testing, anything, do us a favor. Hit us up on our social media networks. You can hit us in the DMs. Slide into our DMs.
And, I wanted to just follow up really quickly. I spoke to Christina. She messaged me, and she is still waiting to hear from Public Health, by the way. She's
Right.
still at the quarantine facility, but I think she's going to try and get her baby tested today. So hopefully that turns out okay. And I just feel really bad for Rob and hearing what Public Health had to say, that their hands are tied and can't do anything.
But did you guys hear the honesty in his voice, and also the strength? He said we're going through so much emotion right now. But this isn't about me. It's about me and all of the other people on quarantine. He's still practicing inafa maulik at his lowest point. He's saying, I want to help my neighbors and everybody else.
Yeah, and that's the thing about the people we talk to in quarantine. No one is calling out the whole quarantine process. They understand it's there to protect us as we caught positives in the quarantine
But this
facilities.
is just absolutely heartbreaking.
It is. I hate to say it is what it is, but there are victims in this pandemic and victims who don't even have COVID, right? So 10:19, thank you guys so much. We'll see you tomorrow on Friday. For Sabrina, my name is Chris. Hasta. Adios.
Thank you, America.